Hello, hello, hello.
Distinguished guests and esteemed delegates, Namaskar. On behalf of Department of Biotechnology, Ministry of Science and Technology, Government of India, and the Biotechnology Industry Research Assistance Council, I, Taranjeet Kaur, welcome each one of you to BIREX BioNEST and E-YUVA Conclave. This conclave brings together 100 plus CEOs and managers from incubation centers and experts to reflect on our journey, celebrate our achievements, and learn from the best among us. Before we proceed further, let's take a moment to acknowledge the esteemed dignitaries whose vision and leadership have been instrumental in shaping the Indian biotech startup ecosystem. Please join me in welcoming and inviting them to the stage. Dr. Alka Sharma, Senior Advisor, Department of Biotechnology and former Managing Director, BIRAC. Professor Jagdish Kumar, Honorable Chairman, University Grants Commission. Dr. Mrs. N. Kalai Selvi, Director General CSIR and Secretary DSIR. Dr. Rajiv Raghuvanshi, Drug Controller General of India. And Dr. Jitendra Kumar, Managing Director, BIREC. To the dais, please. Okay. We are honored by your presence today. To commence this auspicious occasion, I kindly request our esteemed guests to join us for the traditional lighting of the lamp. I request Dr. Chaya to please escort our guests for the lamp lighting ceremony. This ritual symbolizes the pursuits of enlightenment, knowledge, and wisdom. May the radiant glow of the lamp lead us all towards excellence and success.
Can I take one group picture, all of you?
Thank you, everyone. I would now request Dr. Alka Sharma to welcome our guest of honor, Professor M. Jagdish Kumar. Dr. Rajiv Singh Raghuvanshi. And our chief guest, Dr. Mrs. N. Kalai Selvi. Thank you, ma'am. May I now invite Dr. Jitendra Kumar to extend a warm welcome to Dr. Alka Sharma. Thank you, sir. I now request Dr. Chaya Chauhan, in charge incubation, to welcome Dr. Jitendra Kumar. Thank you. With that, let the BioNEST E-YUVA Conclave begin. So to kickstart this momentous occasion, let's extend a hearty welcome to Dr. Jitendra Kumar, Managing Director of BIREC, to deliver the welcome address. Sir, over to you.
Honorable Chief Guest of this BioNEST E-YUVA Conclave 2024, Dr. N. Kalai Selvi, DG CSIR, Secretary CSIR, Secretary DSIR, and DG CSIR, Dr. Rajiv Singh Raghuvanshi, DCGI, Professor M. Jagdish Kumar, Honorable Chairman UGC, Dr. Alka Sharma, Senior Advisor and Scientist H and former MD BIRAC, DBT. My dear CEOs of the incubation center across India, and ladies and gentlemen. Today I welcome you all to this BioNEST E-YUVA Conclave. I have a very short presentation today just to tell you that how we have progressed so far, where do we want to reach, and what are the opportunities and challenges. This is a very short presentation. It was supposed to be a welcome address, but I thought I would just give a brief of what we can do together. So this is just what we have introduction of BIRAC. It's a Biotechnology Industry Research Assistance Council, which is nurturing innovation from ideation to commercialization. Basically, this is what BIRAC does. It's a Government of India enterprise, Section 8 not-for-profit company under the aegis of Department of Biotechnology, Ministry of Science and Technology. It was set up in 2012. It supports startups, entrepreneurs, medium and large scale companies for high risk innovation to develop innovative, affordable products to address the unmet needs. It's a central agency which enables the innovation in this country. One of the flagship programs that we have come together to celebrate is the BioNEST center that we have set up across the country. The achievements that we have for the last 12 years of BIRAC existence is captured in this slide. We have 95 incubation centers and E-YUVA centers across the country. We are adding 20 more, so the number is increasing more than 100. Looking at the size of the country, this is definitely a small number, but I think in due course of time, this number will increase to maybe thousands, because the countries like China and US, they have, very large number of incubation centers. These incubation centers are engines of growth. They are engines of economic growth. And unless we strengthen these centers, I don't think the institutional mechanism of strengthening the innovation ecosystem can be achieved. We have created 9 lakh square feet of incubation space so far through these incubation centers. We have 15 lakh student entrepreneurs engaged. We have 800 plus products in the market. We have 1300 plus IP filed, 28,000 plus proposals that has been assessed so far, 4,800 plus startups and entrepreneurs supported, 5,500 crores of follow-on funding, which has been raised by more than 130 startups. 100 plus national and international partnerships have been achieved. 400 plus academicians have been supported. Even academicians who are into translational research, we have supported. I will come to this point more elaborately, because this is a very, very important point to deliver the deep tech startup companies in our country. 35,000 plus high-skilled jobs have been created. 10,000 plus mentors pool have been created. These are very important because, after all, scientists who start the businesses, they need mentorship, and we have created a very good mentorship network. 6,600 crores of total investments has gone into this effort. 4,000 crores, out of which 4,000 crore plus funding is through BIRAC, and 2,600 crore co-funding from industry and others. These BioNEST centers are pillars for innovation superstructure, I say. Because once you have created a baseline, you can build superstructures on it. What does it mean? It means that suppose some institutional mechanisms have to be created, because our universities, for some reason, they have not been geared towards entrepreneurship the way it should have been, or the way the other countries have achieved. So BioNEST or BIRAC has tried to fill this gap by setting up these incubation centers or innovation centers within the universities, within academic research institutions. once these centers are created, and these are separate entities, so they have administrative flexibility to work, they have mechanisms to support the entrepreneurs. So the research that is happening in the universities, academic institutions, they can come into the market through these incubation centers, and the BIREC support to the incubation centers as well as to the startups there has been immense. So what kind of the support structure is there? Once these centers are created, we have created different mechanisms to support. One is, this is captured in the slides, E-YUVA, which is, you know that there are fellows in the universities and colleges who can do their proof of concept within these centers. These are pre-incubation centers, basically, E-YUVA. Then Sitare, then Sparsh program, then Biotech Ignition Grant, which is a flagship grant that you all know. Academic innovation research, I was talking about how do we support the academic innovations within the universities. So we have a small grant which is given to the professors or scientists who want to create an entrepreneurship, and that is academic innovation research. SIBRI, BIPP and other programs are there for follow-on funding. These are co-funding mechanisms where entrepreneur also has to bring some funds from their side. And this is all topped by the funds that we give to the incubation centers as well as from our side also through seed fund mechanisms, through LEAP fund, through ACE fund and PCU. ACE fund is a fund of funds, and basically it's a equity-based fund. The key offerings of these incubation centers are plug-and-play infrastructure and lab. That is very much important to lower down the entry barrier, because biotech is a huge capital investment game, and it's very risky. Time consumed is very high. So it's very difficult for any entrepreneur to enter into this space compared to, say, IT or other fields. What does this incubation center do is to lower down the entry barrier for this by setting up the plug-and-play laboratories, by setting up the equipment facility, and providing all the other services such as mentorship, funding, networking, branding, etc. If you see the progress of BioNEST, it is actually very encouraging. For example, in 2012, we had around 6 BioNEST incubation centers, and now it has grown to over 80, 95 actually, 95 plus 20 E-YUVA centers. So although it is encouraging sign, but there needs to be more and more such centers which are important for our country. The map shows the distribution of these centers across India, and as you can see, it is fairly uniformly distributed. So it's inclusive in nature, but at the same time we see high density in southern states and the western and the northern states. Even in northeast also we have set up so many incubation centers. In the eastern part, HIT Bhubaneswar is doing, but other eastern states are not. And the central part we have to strengthen more and more. Now, next 2 slides I will go deep into little conceptual aspects of what we can do together to strengthen this movement. So first of all, let's see what are the opportunities we have in this field. As I said, universities have not evolved organically for startups and innovation culture so far. But the things are changing. We are seeing a lot of activities in universities and academic research institutions, IITs, etc. However, setting up of BioNEST centers in these institutions have actually catalyzed the entrepreneurial spirit of these places. So this is an opportunity. So more and more universities and colleges have to be tapped to set up these centers so that more and more entrepreneurs can be nurtured. So this is an opportunity, and that BIREC has to actually, go and enable this. Second is, most of the startups in BioNEST are from eclectic background and very less from academia. BioNEST to forge links. What does this mean? Now, the basic purpose of incubation centers is to actually enable startups from the academia, wherever they are set up. This is the basic purpose. But we see that most of the startups that populate these incubation centers may not be from the, they may not have origin from the academics, I mean, from the host institution academics. For various reasons, we have to strengthen that, but that's an opportunity that BioNEST centers have to tap into. They should engage more and more with the scientists and professors to see that their innovations, turn into commercial ventures through entrepreneurial mechanisms. Right now, there is a technology transfer that is happening from the research departments to the industry, but those are actually not very successful so far. I mean, there are examples, but these are not very good examples. I mean, there are not large number of such success stories. Maybe CSIR has some success stories, but universities definitely are lagging behind. But this is again an opportunity for BioNEST centers to create institutional mechanisms to create ventures out of these institutions. For example, can we create entrepreneurs in residence program where these entrepreneurs will work with the inventors and then create a spin out which can be incubated in this incubation center, and it can be linked to the funding. So these mechanisms, if they are developed through institutional mechanism, it can have a game changer effect, because most of the public research institutions are funded through government, and these are the only funded who are engaged in R&D. There is less and less private R&D in our country. I mean, it has to be encouraged, but so far private R&D is very less. Most of this R&D which happens is through public grants and money. So we have to tap that. And it's very important to say at this point that our research funding also is very less compared to developed countries which have taken the lead in innovation. For example, our R&D expenditure is only 0.7% of GDP, and mostly these are going to the public research labs. For example, in China and US, these numbers are around 3 to 4% of GDP. So even if we reach 2% of GDP, I think it can be a game changer. The third opportunity that I feel for the incubation centers is the industry connect that we don't have. Because venture funding, the early stage venture funding is still lacking in India, it is important for bigger industries to partner with these startups, and incubation centers can facilitate that. So that more and more such efforts have to be there. I think BIRAC will be very happy to connect you with the industry and facilitate that. So this is again another opportunity which I think incubation, you all know this, but I'm just trying to emphasize and trying to see that you connect with this. Innovation superstructure. What does this mean? Once you have created a basic infrastructure for startups to do proof of concept, I think that mechanism can be scaled up. When we say scaled up, it has different ramifications. One is the one aspect of scale up is pilot scale, where you can scale up the facilities. For example, if you have a 10-liter fermenter, it could be you can create 100-liter fermenter, 1,000-liter fermenter facility in the center. If you have only laboratories, regular laboratories, you can create a clean room, GMPs, etc., which are also important for startups to go ahead with their value chain. Because these structures are already present, and because we are evolving in the funding mode, you can tap into the resources. For example, we have now announced the biomanufacturing project. So I know that many of you have applied, but I really want to more and more people to apply, because this is the structure that you have built, and superstructures can be built easily. Instead of finding some greenfield projects and to establish, and which will take another 10 years, for you it may be very easy to tap into that. That's what I'm trying to emphasize. The other thing is the support for regulatory pathway and more, because this is another bottleneck that startups face, and so these incubation centers along with BIRAC definitely should help navigate the pathway for regulatory clearance for these startups. What are the challenges? And you all as the CEOs and the incubation managers have faced these challenges, but let's revisit this and see what can be done. There is a sustainability issue with this incubation centers. We all know to make these incubation centers sustainable is a challenge, because AMCs are huge. I mean, if you have a 10 crore equipment, by the thumb rule, 10% of AMCs will be around 1 crore per year. And then you talk about depreciation. Equipment will depreciate over a period of, say, 5 to 10 years. So after 10 years, again, you have to infuse money to create that kind of facility, which is again a challenge. And then huge electricity costs. If you are not cross-subsidized by your host institutions, it means that you have to pay a huge electricity cost, which may run into crores. So, annually I'm saying. So if you factor in this, it costs around 3 to 4 crores, and then on the top of it, manpower, etc. I would say that to run an incubation center, you need annually at least minimum, if you don't want to even scale up, at least 5 CR. Now, how will you generate that money is a very, very important aspect to look into this. And various incubation centers have devised various mechanisms to become sustainable. Some of them have operationally become sustainable, and we will hear some of these success stories also in these different sessions. But let me tell you that one of the mechanisms that which can be used for making it sustainable is of course, you all are charging rentals, but those are subsidized. You cannot load all this for rentals, because then incubation effort and the whole objective will be defeated. So maybe you can think about other innovative mechanisms. Maybe you can tap into the CSR resources. Maybe you can tap into more and more mechanisms to leverage your facility, GMP facility, or the clean room, or the pilot scale that you build up, because those can give more revenues compared to general rental. That is my observation. So if you create such superstructures, I think you have a better chance of becoming sustainable. The other is scaling up. So if your area is huge, then actually you can become more and more sustainable. And that has to be filled up also with the incubators or the startups. Manpower, that is a second challenge. I think to get a good CEO and a good manager is very, very important. It requires a lot of combination of skills, scientific as well as managerial, as well as the business acumen, which is very rare to find. Therefore, we have to nurture these kind of skills. We have to create such training programs to create these kind of manpower. I think if deep science tech has to be evolved in this country, the incubation managers and CEOs also have to be very, very technically sound. This may be contentious, but this is my observation, because ultimately it is up to you how you actually evaluate these technologies, and as a head of these institutions, you must understand the deep tech behind it. Of course, nobody can be expert in all the fields, but at least a good grasp of the subject is very important. Support from host institution is very, very important. You all have to actually see how you can secure the confidence of the host institution. Of course, this is not to say that they were not interested in all, because ultimately they have created the incubation centers. But the sustained interest, because it's their baby, it has to have some kind of mechanism to support when the time comes, even when you are not operationally sustainable for some time or long time. The host institution has to actually take care of it, because BIREC can fund only up to 3 to 5 years. Maybe you can again apply for another term, which is again 3 to 5 years. But then 10 years after that, what will happen to the incubation center is something that you have to think about. The other is collaboration and resource sharing amongst BioNEST. This is another important point which I wanted to emphasize, because we have created a lot of resources in different parts of the country, different incubation centers. Some are strong in some areas, some are strong in other areas. So you must collaborate and share the resources so that your own strength increases. Of course, this is fraught with little difficulties, because you all are trying to become excellent, trying to attract the incubations and incubators, the startups. So it becomes a point of contention also. It becomes a conflict of interest between the parties. But it is your skill and acumen how you actually find the complementarity, how you co-incubate the startup rather than getting into the... So try to convert the competition into collaboration and then see how you all can grow together. Some of the incubation centers are advanced, most of them in South, for example, Bangalore, or in Pune, Venture Center, KIIT Bhubaneswar, etc. They are prominent centers. Not to mean that other centers are not performing well, but you all are doing very passionate and good work. I'm trying to say that some of these incubation centers are very old, and you can learn from them. And today's session, most of them will be there. So it's a learning experience and sharing experience together. So if you can collaborate and share the resources amongst you, I think it will be a great, game changer for the incubation industry. So this is all I have to say, and I think you all are our family members as a BioNEST incubation centers. You all are one family, and I think every year we should celebrate our success. We should share our experiences. We should come together at one platform and see how we can all win and take our country forward. Thank you so much.
Thank you, sir, for taking us down memory lane from our humble beginnings to where we stand today. Your insightful words have set a delightful tone for this event. Thank you once again. I now invite Dr. Alka Sharma, Senior Advisor, Department of Biotechnology and former Managing Director, BioRec, to deliver the inaugural address. Over to you, ma'am.
Thanks, Taranjit. A very good morning to all of you. Respected Ma'am, Dr. Claire Selvi Ma'am, Secretary DHR and DG CSAR, Dr. Raghuvanshi, DCGI, Dr. M. Jagdish Kumar, Chairman UGC, Dr. Jitendra Kumar, MD BioRec, and all dignitaries in this hall. So first of all, I would like to congratulate BioRec to organize this conclave by bringing together all the stakeholders. Dr. Jitendra Kumar has provided an excellent overview of the activities and the BioNEST and E-YUVA in the centers, and also highlighted the challenges which are being faced by all the stakeholders, but from the BioRec point of view, what has been observed so far and how to address these challenges that will be discussed during the day under various sessions. So I would like to just take you in the journey when there was no biotech innovation ecosystem in the country, and before BioRec was established in 2012. Before that, the biodesign program was implemented by Department of Biotechnology under the leadership of Dr. M.K. Bhan. That time, some innovation ecosystem was created, especially for medtech devices, and that now we can see the fruits of that program after more than a decade. Then Department of Biotechnology thought that there should be an arm of Department of Biotechnology to promote, support, nurture public-private partnership across the country, and then BioRec was established in 2012. And through various schemes of BioRec, including the way we are discussing today, BioNEST E-YUVA, the vibrant biotech innovation ecosystem has been created across the country. And as you heard from the MD, that as currently we have 95 bio incubation centers across the country, and that they are serving as landing platform for the startups and innovators. So bio incubators that we all know that are important for creating a conducive environment for the growth of the startups and facilitating their transition from early stage research to the next level. And these facilities are mainly located within the university system, but they are also linked with the research institutions, research hospitals, and also standalone centers. And the centers have also been seeded in emerging clusters of Tier 2 and Tier 3 cities, bringing opportunities closer to the entrepreneurs. They play an important role in supporting innovation and entrepreneurship in biotech industry and providing facilities such as access to high-end infrastructure, specialized and advanced equipment, business mentorship, management of intellectual property, legal and regulatory guidance, and of course networking opportunities. But in the current scenario, it is important to have some strategic approach to address key elements for taking the existing ecosystem to the next level, maybe in terms of infrastructure, that is upgradation of the existing infrastructure and also creating new infrastructure as per the requirements, resources including funding from various other organizations, and not from always from government, partnership and support system. However, the limited indigenous capacity to transform research leads into viable commercial products. This is the critical barrier which we all have felt, and there is a gap. So how to bridge that gap? That is also one of the important points to discuss among ourselves. So the transition of bio-based products from lab to market is being hampered by lack of required facilities for progressing innovations to pilot scale and then pre-commercial manufacturing scale. Therefore, most of the startups and SMEs, they fail to move beyond proof of concept, that is mainly at lab scale, and in some of the cases in the bio-incubation centers also. So globally, what is the practice being followed? That the public sector seeded initial investment for biotech infrastructure capacity building has been instrumental in development of local ecosystem, and then which propels steps through conducive public-private partnership policies. So in order to bridge the gap, and the specialized facilities and advanced technology are required, and also for the rapid prototyping, testing, and optimization of biological systems, and this is only possible through setting of biofoundry, which is an important component of the biomanufacturing initiative of Department of Biotechnology, and which has also been mentioned by Dr. Jitendra Kumar. So as many of you may be aware that keeping in view the national priorities of accelerated green growth, the Department of Biotechnology has initiated a major program on fostering high-performance biomanufacturing, an integrated approach towards promoting circular economy for green, clean, and prosperous India. The collaborative program is to be enabled by public-private partnership, international collaborations, and also inter-ministerial collaboration. So, the DBT organized a series of brainstorming sessions across the country with all the stakeholders, and to identify gaps and challenges. And also national consultation was organized by Department of Biotechnology. Based on the recommendations we received from all the brainstorming sessions, 6 thematic areas have been identified. That is bio-based chemicals, enzymes, biopolymers, that is first thematic sector. Then functional foods, smart proteins, second. And the third one, precision biotherapeutics, which includes cell and gene therapy, monoclonal antibodies, mRNA therapeutics, climate resilient agriculture, carbon capture and its utilization, futuristic marine and space research. These thematic areas will be augmented by bioenablers in the form of setting up a biomanufacturing hubs and biofoundries, and also bio-AI hubs. So this initiative has been taken along with BioRec for setting up biomanufacturing hubs across the country, and this has been discussed at the highest level, and we are hoping that we will be able to implement this initiative very soon. So the primary goal of biofoundry is to accelerate the development and scale up of technologies by providing researchers and entrepreneurs with the access of required facilities and expertise, which is the need of the hour. Because in bio-incubation centers, they get the access for infrastructure, resources, or mentorship, but there is a need to take up that to the next level, and that can be done with the setting of bio foundries across the country to provide specialized facilities for end-to-end process and thus to bring the product into the market. So that has been kept in mind to bridge the gap which are being felt by the innovators, startups, and in many cases industries also. So this will enable startups, SMEs, industries, and academia with access to shared infrastructure facilities, resources for pilot and pre-commercial scale biomanufacturing or viable commercial bio-based products. And it will also provide otherwise missing access to process development, process optimization, pilot and pre-commercial scale testing, and validation facilities. And this will enable nucleation of stakeholders, engagements such as industries, private investors, regulators, service providers, global talents required to yield a globally competitive innovation ecosystem. So, looking forward to working together for this common goal and to realize the vision of making India a $100 billion biomanufacturing hub that was defined in that National Biotechnology Development Strategy document, and that was approved by the government. And this was one of the major components of that strategy document. So now the ecosystem has been created. Now the need is to take that ecosystem to the next level and also working together with all the stakeholders to achieve this goal. Thank you very much.
Thank you, ma'am, for officially inaugurating this conclave. Your vibrant and energetic words have consistently been a motivational source for all of us. Thank you. We are pleased to have with us our esteemed guests of honor who have graced this occasion with their presence. First, may I invite Professor M. Jagdish Kumar, Honorable Chairman of University Grants Commission, to share his insights. Sir.
Good morning, Dr. Kalai Selvi, my distinguished colleagues. When I entered this hall, I was talking with some of you, and a question popped up in my mind. Suppose we are traveling from point A to point B on a horse, and you find that the horse is taking too long. So what will you do? You will call a trainer, and you train the horse to go faster. And tomorrow it will go faster, and tomorrow you are not still satisfied. You train it even more, but then it reaches a saturation. But a smarter one, he will say, no, I will not use the horse, I will use an electric vehicle. That is what is called a transformative change. Today, we are witnessing that in our country. We no longer dependent on evolutionary development. We want to have transformative change in our country in every domain. But how will you bring that transformative change? You know, in 1870s, the child mortality rate was very high. A doctor who was working in a children's hospital, he was so much tired, he wanted to take a break. He walked to a nearby park, Lodi Garden, and when he was going around, he found there a person with a small box and small chickens there inside. So he asked this doctor, you know, why are you doing this? He said, sir, when I put these small chickens in this warm box, their survival rate is very high. Then suddenly something clicked in the mind of the doctor. He said, can you make 2-3 of these boxes? And he got them done and took them to his hospital. And the small kids, as soon as they are born, he put them in this, what is now known as the incubator. That warmth, the circulating air, which is hot, it suddenly changed the mortality rate. And it proved that children can survive if they are put in the incubator. And how did this idea arrive? Not by doing some research inside the laboratory. When he went outside his own environment, when he interacted something very unusual, he found a new idea. And that is how transformative ideas are generated. And today, in our educational system, for too long since our independence, we have become so conservative. We have become so restrictive. We have built these disciplinary boundaries and restricted the innovative, the creative minds of our kids to become completely, ineffective. And this is where we need to bring a change. I was told that the BIRAC is doing its best to bring the BioNEST and E-YUVA activities into the universities because there is a gap. The universities are not yet ready to create these kind of things. Therefore, BIRAC is trying its best to remove these gaps. Now, let me tell you, suppose you come with a modern LED light. It's very, very energy efficient. And I come to your house and say, I want to give it to you. And when you go and you try to fit, you find that your socket, it doesn't allow you to fit this. The same situation will happen when BIRAC is trying to fill up these gaps. Our universities are so conservative, it doesn't fit there at all. And that is the reason why, not just only in BIRAC case, it could be semiconductor industry, it could be communication technology, it could be manufacturing industry which is trying to come and fill up these gaps. But you suddenly find that our universities are like these bulb sockets. You cannot really fit there. And that's the reason why we have brought the National Education Policy 2020. And since the last 4 years, since the time we have launched the NEP 2020, there are many, many transformative changes that are happening in higher education, which will please you. Because you can now come and easily fit there and we can grow together. Now, let me tell you one of the things that we are doing on a large scale. Just as this doctor who went outside his domain to find something new, we need to encourage our students to go beyond their own disciplinary boundaries. And that's the reason why we have come up with a national credit framework. And in this national credit framework, we are saying that any kind of learning can be creditized. Not necessarily only the learning that takes place in the classroom. It can be your own self-learning, it could be an online learning or you go and work in some industry and come back and say, this is a learning that I have acquired and I use a reliable assessment method and I creditize that and add it into your educational program. So now, for a long time in our educational systems, we trained our students to focus only on their academics. But today time has come to give them an opportunity to focus on their career goals also. Now, out of 4.3 crore students that we have in the higher education, you will be surprised to know that nearly 80% of them, they pursue only undergraduate degrees. And a small percentage of them go into the postgraduate programs. And out of these 80% of the undergraduate students, majority of them, they do BA, BSc, BCom. And what is the future of these kids once they come out of these universities? Are we providing them enough skills for them to be employable? Today we talk about unemployment. Actually, there is no unemployment because there are so many jobs that are coming. You create so many jobs. And when you come to the university, do you find students who can fill up the requirements of you, who can stand up to the requirements that you have? That's not happening. And that's the reason why we have what is known as underemployment. You have the jobs, but you don't have the people with the required skills. So therefore, what we are doing now is that, all right, you want to do BA history, you do 50% of your credits in history, but the remaining 50% of the credits, you want to work in financial management, you want to take some courses in risk management, or you want to do in data analytics, you can go and do it. This is the kind of opportunity that we are providing, and you all agree And I was also told during the inaugural presentation that if you want to succeed, you need to have knowledge of multiple disciplines. And how will you acquire this unless we provide that kind of ecosystem in our educational system? And this is happening today. And we also need to bring more people who can provide this kind of training in the university system, because our university teachers are not equipped to provide training to our students in the emerging areas. They cannot provide the emerging skills to our students because they have come from a particular ecosystem where they never underwent these kind of training. For example, even I came through the same system where we were never taught about the importance of teamwork. We were never taught about the developing the ability to take risks, calculated risks. We were never told about being a problem solver or a solution provider, but things are now changing. So what we are doing now to provide these kind of multiple domain knowledge to our students, we have recently launched a platform known as the SWAYAM Plus. And on this SWAYAM Plus, we are now meeting organizations who have high quality digital content in various skill areas. And we will be putting this digital content on SWAYAM Plus, and we will be encouraging the students across the university system to take these skill courses as part of their regular educational degrees, so that they are not overburdened to take extra credits to become skillful. So a large number of organizations are coming to provide this kind of digital content on our SWAYAM Plus, but we are also talking to other institutions who can provide in physical mode actual training. You see, when you go through ideation to concept building and its validation and commercialization, you use very advanced equipment. You use the state of the equipment. Do you have enough people who can maintain, who can repair, who can operate this equipment? And it is these students who can be trained if you come to our universities and you say, yes, in this biotechnology area, we have this equipment and these many jobs are there. We will provide the training to your students. Then we say, yes, we will creditize this training, and then we will add as part of the degree program, so that when these students pass out, they can be easily, immediately absorbed in your own organizations. So I invite all of you from the biotechnology area, if you have specific programs, either they are online based or physical mode training that is required, let us sit across the table and creditize this and make it available on our digital platform, which has just been launched. So there was another thing that was mentioned, that there is not enough industry academia collaboration taking place. Unfortunately, here, there are two hands that are required to produce sound. Both industry and academia have to play an equal role if we want to build such kind of collaborations. It's like a marriage, right? In a marriage, unless we have shared goals, how we want to raise our kids, we cannot really succeed. That's the first thing that we need to establish between industry and academia. What are our shared goals? Let us identify those shared goals and combinedly in a collaborative way, let us work in realizing these shared goals. Another major problem that I will see, I would like to bring to your notice, is the difference in the cultural attitudes of educational institutions and industries. In educational institutions, we have a laid-back attitude. We don't work, we don't change the timelines. But in industry, it's not like that. So you need to bridge this gap. How do you understand each other's cultural background and then work out shared goals? The other major challenge I see is the communication, the absence of effective communication channels between industry and the academia. Especially in the case of pharma industry or biotech industry, the professor may be an outstanding academician, but the professor may not be aware of the regulatory framework of the pharma industry. So there has to be proper communication between industry and academia, to educate each other, to learn together. One last thing that I would like to mention is what is lacking is between industry and academia is the trust in each other. Because the industry is always trying to look at the ideas generated in the university and commercialize it, whereas the university system, they want to publish it in some top journal. The industry persons may feel that without telling us, they may go and publish and I may not be able to commercialize that idea. So we need to build trust in each other. We need to focus on various mechanisms to bring us close to each other. If we only keep lamenting that there is not enough industry academia collaboration, even after 50 years also we will be doing the same discussions in halls like this. So let us step forward, take the first step and create a better ecosystem for industry and academia. I would like to stop here. I'm sure I might have already crossed my time. The organizers have given me 10 minutes time. Maybe I have already crossed that time, so I would like to stop here. But I would like to tell you that UGC as a regulator, we would like to be a facilitator, and any of you are welcome to come to UGC, or if you tell us, we will come and talk to you, and let us work together. Let us empower our youngsters across the country so that we can build a fully developed country by 2047. Thank you very much.
Thank you so much, sir, for your enlightening address and making everyone present here aware of our new transformative policies in Indian education system. Thank you once again. Our next guest of honor, Dr. V.K. Paul, could not join us. A member from Niti Aayog could not join us for this occasion due to some unavoidable last-minute meeting, but he has sent his best wishes for the conclave. Join me in welcoming our next guest of honor, Dr. Rajiv Singh Raghuvanshi, the Drug Controller General of India, to share his insights with us. Sir, we cannot thank you enough for gracing this occasion. Over to you, sir. Thank you.
Good morning. Respected Professor Jagdish Kumar, Dr. Kalai Selvi, Alkaji, Jiten Kumar, and delegates sitting in the hall. I find myself to be the only person in this hall to be out of place, because most of you are free thinkers and I'm supposed to be restricting the free thinking. But next 10 minutes, I would try to convince all of you that we are not restrictive. Actually, we facilitate the innovation and help people like you to convert your thinking into product, which is ultimate goal for this kind of setup. So let me start with our childhood. I'm sure everybody would have faced this. Our mom used to say that you have to be back by 7 o'clock in the evening from playground. And we always wanted, no, it should be 7:30 or 8 or 9. And we should be left to our will, and whenever we want to come back, we should be able to. So, I mean, that's probably the best analogy of what we do today, of convincing you through regulation that there is a boundary. And unless until you work within that framework of boundaries, your thinking, your rather innovative thinking, will take much more cost and much more time to get it converted to a product, which is probably one of the bigger problems today the whole world is facing, that how to bring products as early as possible and in the quickest fashion to the market for the service of the public health. So I remember when I was doing my PhD in National Institute of Immunology. So one day, our professor came back from one of the industry meetings, and we were developing some controlled release vaccine formulations, and we were actually struggling that what will be the development path to bring that to market. And in fact, we were not finding a solution of that regulatory path. And one day he came back from an industry meeting and he was so happy that he said that, there is a solution to what the problem which we're facing, and there is a way of bioequivalence where you can actually show your what we are developing with the existing product, that your immunogenicity and titers are similar to something which is already existing in the market. So your path gets curtailed and you can basically develop it faster. So I'm just quoting this to let you all know that at that point of time, there was a complete lack of awareness from regulatory point of view, and there were no systemic support system which would have solved that problem in time, because the most important is in time. We got the information, we got later, and probably if we would have known in the beginning when we were strategizing the project, we could have done much better than what we did. When I went to industry and we were working in R&D, I am basically a trained formulator. The most hated community in the industry setup was actually the regulatory team and the quality assurance team. And the reason was that in R&D we used to do a lot of things, keep on thinking, and there was no stoppage that you have to stop here. And these guys, the moment we go to them, that now we have a product, they will bring out so many problems in this, that no, you don't have this, you don't have this data, you don't have that. And ultimately we would, what are they saying? And that actually would make them most hated community in the whole setup. We would never like to interact with them. But later on, we actually came to know that whatever we did was useless and would have gone waste if that regulatory support was not there. And as the fate would be, from that innovator mindset, today I'm heading the National Regulatory Agency in this country. And many a times actually I go through the internal conflict that actually whatever I'm doing as a role of head of National Regulatory Agency, am I actually restricting the innovation? And the innovator's mind within me is actually sometimes telling me that what I'm doing is not right. But ultimately, what I now have started realizing that we have a very strong role to play if these innovative thinkings and thought processes have to be converted into a product. So ultimately, it's not a question of good and bad. It's a question of conflict between these two thought processes, which is little restrictive than the other one. And both, if you see, if we have to develop a product, both of them are actually complementary. In absence of one, the other is actually would not be able to do the work optimally. Especially in healthcare, where we are actually dealing with lives, human life or veterinary life, or maybe anything like plant, any living system when we do, we have to be more careful with respect to what we are doing and what we should not do. The famous thalidomide story, which actually shaped up the whole future of USFDA, if I can say, is actually a very live example of that. Whatever happened at that point in time when this thalidomide fiasco happened, probably because of lack of knowledge in the regulatory system, something which was required to be done before putting that into market like a drug was missed, and which ultimately caused all the fiasco which happened in the market after use, but did something good that after that the whole regulatory system realized that there is a need for very strong thinking when it comes to regulating something which especially deals with life. We also know that when we are especially in drug development domain, not more than 10% success rate is normally reported. And this is something all of us never like. This 10% should be 20%, 30%, 40%. But because of the need of safety and efficacy, which is tagged to all these developing entities or assets, the regulator has to create that framework which actually supports the evaluation of the product for it to become safe and efficacious both. And if regulations are not there, then the 90% assets which do not progress to market, most of them would be in the market. And that is not something which all of us want. There would either be a risk of safety or there won't be efficacy. So, just to say that whatever the regulatory system does is to support, to be in a state where those 10% only reach market which have demonstrated the safety and efficacy of the product. And as I said that this regulatory information, it's very important to get that timely information when we are developing a product. And the initiatives which BioRec has been taking, which is beyond the financial assistance, the infrastructural support to help the innovators, I think they are also supporting and helping the innovators when it comes to regulatory advisory, where my organization, CDSCO, also is a stakeholder. We recently launched a scheme called MedTech Mitra with ICMR and NITI Aayog. We launched it in February, last 2-3 months. We now see a huge influx of innovators in medical device sector coming for advisory, and most of it is actually in the regulatory domain. In last 2-3 months, we have actually had the queries from almost 200 entities who are working in this startup and innovation space to get clarity on how do I develop the product. Now I have idea, I have prototype, but what next? Where the regulatory play comes into discussion. So that's actually becoming hugely successful, and I'm sure that is going to help. And I'm sure BioRec is also thinking something on those lines. And CDSCO as an organization is there to support this whole initiative of bringing more and more clarity into the system when it comes to regulatory. And of course taking clue from Professor Jagdish Kumar that we are not going to become systemic sockets. We would keep the socket flexible, that things can come and fit into it, and we facilitate that fitting into that framework which is required for complete conversion of the idea into product. And before ending, I would actually just give you a small incident which happened recently. When I joined as drug controller about a year back, and I was basically going and interacting with the industry clusters. So during this kind of interaction with industry cluster in North India, you were becoming a little more stricter, if I can say, because the context in the country at that point in time was that the regulator had to become a little more assertive and aggressive and stricter if things were to be controlled. A lot of things were happening, especially if you all must be remembering that cough syrup episodes. So that was the period when that interaction was happening. And then one of the industry members stood up and said that, sir, since you have come, before you it was more of a facilitating organization, and since you have come, you have become a regulator and not a facilitator. So I said that very well received. The comment is well received, but let me also tell you that if I have to be a regulator, I would rather be regulator and not facilitator if I have to control the whole issues which are currently going through this pharmaceutical industry in this country. So there is a very thin line between facilitator and regulator. All our bosses tell us that let's be more having a role of facilitator, but it's actually a very thin line, and we have to see that where do we stop becoming a facilitator and start the role of regulator. And that is something where some of us succeed, some of us fail the expectation of the customer. But to the extent it is possible, the current organization in CDSO is trying to be facilitator and not that traditional regulator. And we would certainly be available for helping this whole gathering through an institutional mechanism which BioRec would probably be creating along with CDSCO. And otherwise also, we are available. We have a mechanism where we have a system where we are open for discussion through a system called pre-submission meetings, but those meetings are when the product is at a very advanced stage. In the stage where incubators work, I think there is a need for another kind of institutional mechanism where at the early stage of a product development or idea translation, the regulator can actually interact with innovators and facilitate the thinking and give a path of development. And we would certainly help in doing that role and help this whole system ultimately for the good of the public health in this country and beyond. Thanks a lot.
Thank you, sir, for your informative address. I'm sure each one of our audiences has gained valuable insight from your remarks. Moving on with the agenda, I now invite Dr. Sonia Gandhi, Head Regulatory Affairs and Policy Advocacy at BioRec, to come to the dais, please.
Thank you, Tarun. Namaste and a very good morning to the honorable dignitaries on the stage and esteemed guests in this hall. So BioRec, as you all are aware, is fostering innovations in the biotechnology space, whether in the laboratory of a university, institute, or public and private enterprises. Our impact is visible from the network of 95 BioNEST incubators, 5,000 plus beneficiaries, and more than 800 products that are already in market and contributing to the affordable healthcare and green and clean circular economy. To strengthen these efforts and increase the impact, we are pleased to introduce a dedicated unit, Regulatory Affairs and Policy Advocacy Division, with an aim to drive innovation through navigation of regulatory complexities, harmonization of global regulations, and advocate for policies that catalyze the growth of startups, SMEs, and entrepreneurs in this dynamic landscape of regulatory and policy affairs. So this division will collaborate and work closely with CDSCO, NITI Aayog, and other stakeholders, and it will play a pivotal role in navigating the intricate regulatory and policy landscape for smooth execution of BioRec's innovation-focused objectives. So although we are already working through First Hub in this domain, but BioRec aspires to act as a central agency for navigating the regulatory approvals and provide policy insights for scientific knowledge generation, leading to evidence-based regulatory frameworks in biotech domain. So we envisage to open regulatory offices across academic institutes and incubators in India for regulatory hand-holding, leading to efficient translation of research from lab to market. So with great pleasure, I request the dignitaries to unveil the poster and launch this initiative. Please.
Let's give a huge, big round of applause as we commemorate this significant milestone. Congratulations to everyone involved in this important initiative. Thank you, Dr. Sonia. Join me in welcoming our esteemed chief guest who needs no introduction, Dr. Mrs. N. Kalai Selvi, Director General of CSIR and Secretary DSIR, to address the gathering. Thank you, ma'am.
Namaskar, Vanakkam and pleasant morning to every one of you. I'm extremely happy to be a part of this very important event being organized by BIRAC in the name of BioNEST and E-YUVA. First of all, I'm totally impressed by the combination of BioNEST and E-YUVA. And the design is also in such a way. Recently, we purchased one USB pen drive that also has a circular middle portion and a felicitating link. So rightly, you have included E-YUVA there so that it can fit into any kind of a laptop. I think to join with Jagdish ji, whenever we are going from India to abroad, normally we just go with a special adapter. So here it is a 3-way pin and there we have only 2 pin, and therefore we always go with an adapter. And I think I really appreciate, congratulate, and all my best wishes to UGC, because you are coming up with a number of catchy and very timely relevant, and it is very society relevant, and it is very much India relevant activities with respect to educational policy. And I'm sure you need not hereafter search for any adapter or need not worry about the mismatch between the LED as well as the old socket. I think slowly the way it was discussed, organic growth will take place. And I think we will normally fill up the gap, because you have invited all the people, those who are really required to fill up the gap. And therefore, I should really appreciate Jitendra C, because you have invited a person from UGC. You have invited not a restrictive, but a regulatory facilitating authority. And also, you very thoughtfully included a national laboratory, because Jagdish ji was talking about you need 2 hands to make some noise or to create some sound. I believe you need 2 eyes, definitely. But the third eye is always very powerful. If you have a third eye, definitely you will have a special focus, and you will have some kind of, I would say, special attention also. But I'm not telling CSIR is a third eye. But what I say is, apart from industry, apart from academia, you need an organic linkage. That is where the national laboratories or a structured laboratory arrangement is required to handhold all the startups or incubators. Once upon a time, country was talking about only startups. Slowly, country realized that we have more than 1 lakh startups. But how many startups are successful startups? Therefore, they started thinking about successful startups. Then they started thinking about deep tech startup nowadays. Why? Because then in between there was a blame. People said that most of the startups, they are doing only in food related things and mainly outsourced things only do. There is no depth in the startup. All these blames came in. Therefore, country is always open. Country is always transparent. Country always takes all the criticisms in a positive manner. Therefore, now we are evolving with our own self-realization based announcement that apart from startup, apart from sustainable startup, we have to promote deep tech startups also. I think in that way, BioNEST, BIRAC, E-YUVA, you are doing a wonderful thing. And I would specially appreciate, because within a period of 12 years, actually they got themselves established in 2012. In 2022, they initiated YUVA, meaning is when they were just completing 1 decade, 10 years, they realized that there is a gap. And therefore, they included E-YUVA. Now, within another 2 years, they realized that there is a connect that is required between the bigger regulatory body, and therefore, we need an internal arrangement by means of which this connect could be made smoother, and you are now coming up with the new arrangement. I should really appreciate BIRAC for this new introduction of your own unit by means of which the smooth linkage, or I would say the smooth advisory or the smooth facilitation will happen, and therefore the entire blame will not go in the name of a regulatory, whereas all of us will accept it is not a restricting agency, it is a regulating agency, because we are playing around the lives of human and also the living beings. If the failure is happening to one drug, it is a failure which is associated with one person or with a group of 4 or 5 people. But if the regulatory is not really complied with, then it is going to be a disaster. Therefore, regulatory is essentially required, and therefore very much knowingly BIRAC is now introducing its own unit by means of which you will be taken care of by your own family, because you are inside a nest, which is BioNEST. Now, I should really appreciate BIRAC for a number of reasons, but apart from that, I would say very much into today's requirement, where the country is moving towards. This, when we talk about technology, now basically there are 2 questions. To come up with the technology, should you be educated or should you be smart? In my case, or from my opinion or from my perception, I would say either of the one is enough, or if it is a combination, it is a blessed case. That's why now we are thinking about how best these university students and the next generation leaders of technology could be really made ready, because sometimes industries, they come and say, I want an industry ready guy from this one. And incubators, you will go and say, I need some kind of a startup ready student from your end. And we from laboratories, we will say, we want a person who is having a kind of a, I would say, fancy ideas and a science-preneur kind of a taste. So, but one educational institution or one academia can really come up with number of students with versatile capabilities, and therefore the educational system is now giving all the options, and for what best and to what extent we can make use of it, that challenge lies within ourselves. Therefore, I strongly believe if you want to come up with a kind of a technology, if you start with the ideation or idea, if you start from the technology readiness level TRL 1, up to TRL 1 to 3, you can say it's a proof of concept. Maybe 3 to 5, you can say it's a prototype. Still, I used to always brainstorm and used to discuss very heavily with Niti Aayog that in the country, to move any technology from TRL 5 to 7, I always say that there is no huge funding support which is available. Because to take any technology from TRL 1 to 5, some amount of funding, some amount of infrastructure, some amount of energy and expertise is required. And taking it from 5 to 7, equal amount of energy, equal amount of money, equal amount of infrastructure, sometimes more than all these things is also required. Therefore, what kind of arrangement is available in the country as on date? Therefore, I always used to talk to both Professor Pal as well as Professor Dr. V.K. Saraswat. And I have talked with even PSA also, that one arrangement called the technology scale-up corridor kind of an arrangement is required for the country. So the moment TRL 5 is there, from 5 to 7, you require a different kind of a consortia arrangement. That is where you need somebody from the academia, you need somebody with a knowledge share. It may be from a national lab or from anyone. And third one is the industry, because who can only really take it to the market. Because unless otherwise my product and my invention or my intervention or my science or my technology or my idea, if it is not reaching the market, there's no fun of doing all these things all around. Therefore, in between this inventor or innovator and the market, we need a strong element called industry whose participation is very much essential. And therefore, this technology scale-up corridor or the technology scale-up initiative, that requires a consortium of all the three. And in this case, I'm so happy to note that here, maybe when BioNEST is investing 4,000 crore, they were able to mobilize 2,600 crore from the industry side. I think hats off to you, Ji. I think it's a good number. And more than 50% of your total investment, you were able to mobilize it from the industry also. It's a good scenario. And I feel that in the coming days, industries will also support us enormously and unconditionally. Why? The geopolitical situations are teaching us a lot of lessons. How long we can depend upon any country, even if we just take the case of vaccines. Even today, vaccine vial or vaccine vial machines, across the globe, there is only one patent which is available. And the good part is that patent, its period is also almost getting over. And therefore, if at all a country like India, if at all we are able to pitch in at this particular point of time, and if we come up with some kind of vaccine vial machine, I think we will be able to get the attention of the globe. And actually, we from CSR, we started doing something. Again, we'll come to the regulatory person only. Even if you restrict also, we will come to you. Why I'm telling is, this is very, very essential. So when we are entering into such kind of very niche areas, very much required areas, these are the very hot areas also, I would say. Because across the globe, the temperature, that is 7 degree, 4 degree, less than 4 degree, how the strain, the color change happens, this is the bottom line. So if we are able to crack that particular point, and if India is able to create an impact in that particular area, we will become the global leaders. So to become global leaders, what is essentially required from my perception is the understanding of what is the critical requirement of the globe. So for each and every area, there will be a critical requirement. Without that, we cannot take it further to a great level. That is a USP. So if you are able to crack that one, similarly, if you just take membranes, there is only one membrane. I'm not naming it because we should not say any trade names. There is only one membrane, and this technology is completely controlled by one company. And after so many decades, we are not able to match with that membrane. That membrane is finding its application almost in every area. Starting from water purification, whether it is e-mobility. If at all I say all these clues, you will understand. Even otherwise also you know the answer. So what I say is, what is wrong with India? What is wrong with Indians? What is not there in India? Why we are not able to substitute that particular membrane? Because it is finding its application everywhere. It is kind of an omnipotent membrane, but being controlled by only one patent. Why we are not able to crack that one? So that attempt is also going on in the country right at this point of time. Therefore, I really make it as an appeal from my end, apart from your passionate areas, apart from judging the area in which you have to do your startup or your incubation based on its market potential, its market share, or its market visibility, or its global share, or its global visibility, or its requirement, I make it as an appeal to each and every one of you. Please find out areas wherein monopoly exists. Let us just break that particular thing. Then India will be appreciated globally. Because we want to get global recognition, and we do not have a lot of wait time. Already a lot of time has been spent after independence. Now we are left with only 2.5 decades only. 2047 is so close by. 2030 is almost, it is nearing us. Therefore, what is the preparedness with which we are all functioning? So that is where organizations like CSIR, like UGC, like the regulatory authorities, like BIRAC, like DBT, So we are all thinking in that direction. But we from one side, if we keep on thinking, then who is there to implement all these ideas? So this is where I think this kind of a conclave that really gives a platform to share what is it that we feel like sharing with you. And this should become the takeaway point, and this should be the take-home message from your end. And you can start munching on these ideas, and you can also propagate all these ideas to your nearest neighbors and like-minded people. And you can also encourage such kind of people, and we should form, this is a nest, and we should form a bigger group, because the whole family, the whole India is one family, the whole globe is one family. And therefore, we all should be made to think in one direction, that India should become the supreme power in the coming days. If not immediately, at least in 2047. For that part, every day, at least one time, all of us should think that, what shall I do? What can I do? What should I do? By means of which India will become the supreme power and the global leader in the year 2047. So friends, I do not know whether it was knowingly or unknowingly fixed this particular date of May 17th for this particular event, because today is a very special day. It is a World Endangered Species Day. So many animals are becoming endangered species, not only animals, birds, and many, I would say, many other species, they are becoming endangered. I do not know how many of you are aware. Maybe in the whole country there is one laboratory, research laboratory, which is taking care of this kind of laboratory for endangered species, which is called LACONS, which is in Hyderabad, which is a CSIR CCMB based laboratory, LACONS. And we also have biobank for animals, plants, and especially for these endangered species also. So please visit such kind of places. Just because today, actually we from CSIR, we are celebrating this day because it is a day which is very much relevant to LACONS, the center of CCMB. So country is having lot of infrastructure. Only thing is, just because many times we are getting more than enough things, we may not be even able to realize what it is and where it is and why it is available. So country is already, Mother Earth has given lot of, not only Mother Earth, I would say, Mother Nature, I would say. Because we are rich with mines, we are rich with marine sources, we are rich with soil-related sources, we are rich with metals, we are rich with human beings, we are rich with talents. What else is missing? Nothing is missing. At least in that slide, he was telling industry linkage is missing. But in my version, nothing is missing. Everything, everywhere, we are abundantly blessed. But one thing is missing, if you want me to admit, is we are not realizing that we are abundantly blessed. As long as we don't realize that we are sitting on the gold mine, I think we may not be able to move. This is what actually Jagdish ji was telling. If we keep on moving in the same speed, instead of just going behind the horse, you just move to EV. This is what he said. So if we keep on thinking in this direction, even after 50 years, we will be just talking like this only. This is what you are sharing his concern. I really, really appreciate. Because now all these concerns are being expressed to you just to make only one point very clear. Please realize that we are sitting on gold mines. Without realizing that we are sitting on gold mines. If we make every Indian to realize that we are sitting on the gold mines, if you make every Indian to understand that India is a country which is abundantly blessed not only by Mother Nature, but also by the ecosystem in these days, I think days are not so far off that India is going to be the global power. And I look forward, and I'm sure BioNEST, E-YUVA, BIRAC, DBT, in whichever form you call, all names are, you can call God also, Mother Nature also, in whichever name you want to call. So whichever name you call, it is one and the same. It is the important organization or the important organ of the country by means of which you and me, by working as one team, as one family, should make India to feel proud. And we should make India to become the global leader in 2047. Thank you so very much. Looking forward.
Thank you, ma'am, for your informative address and gracious words of appreciation for BIRAC. Thank you. I would now request Dr. Alka Sharma to felicitate our esteemed guests with the token of appreciation. And to our guest of honors as well. To Professor Jagdish. Ma'am, just a minute. Ma'am, may I now request Dr. Jitendra Kumar to felicitate Dr. Alka Sharma? Sir, just a moment. I also request Dr. Chaya to felicitate our MD, Dr. Jitendra Kumar. Thank you. Today, we are also celebrating the growth of the E-YUVA and BioNEST centers as we welcome 20 new centers into our community. I request representatives from 10 new BioNEST centers to come on stage for a group picture. The centers are IIT Patna, from National Agri Biotechnology and Biomanufacturing Institute, Mohali. Third, BioNEST at JP Institute of Information Technology, Noida. Please come on stage. Representative from BioNEST and Datta Meghe Institute of Higher Education and Research, Wardha. Please come on stage. BioNEST at IIT Dharwad. BioNEST at IIT Mandi Catalyst, Mandi. BioNEST at JSS Academy of Technical Education, Noida. BioNEST at Derby, Bangalore. BioNEST at Biotech Park, Kathua. BioNEST at SRM, Chennai. I'll also request Dr. Manish Diwan and Dr. Chaya to come on stage for a group photo, please. Please, sir. Okay. I also request Shilpi Kochar to come on stage, please. Dr. Shilpi on that side, I think. On that side would be better. Let's give a huge round of applause for these centers to embrace growth and innovation. Done. Thank you. Now 10 new E-YUVA centers. I'll also request him to come over stage. Central University of Punjab, Bathinda. Central University of Rajasthan, Ajmer, College of Horticulture and Forestry, CAU, Parsi Ghat, Shulini University of Biotechnology and Management Sciences, Solan, University of Kashmir, Srinagar, Kannauр University, AKS University, Satna, Punyashlok Ahilya Devi Holkar, Solapur University, Sri Lakshmi Narayan Institute of Medical Sciences, Puducherry, Sam Higginbotham University of Agriculture, Technology and Sciences, Prayagraj. And yes, our team is also here for a group photo, please. That's okay. Give them a huge round of applause for embracing growth and innovation. Congratulations to all the newly welcomed centers. Thank you. As we come to the close of this inaugural session, I would like to invite Dr. Chaya Chauhan, in charge incubation at BioRec, to propose the vote of thanks.
Dignitaries on the dais, esteemed guests, ladies and gentlemen, namaskar. It is my privilege to deliver the vote of thanks at the BioNEST E-YUVA Conclave, a mega congregation of bio-incubation leaders. First and foremost, our deepest gratitude goes to Dr. Mrs. N. Kaleselvi Madam, Director General CSIR and Secretary DSIR, for gracing the occasion today. I would like to extend sincere thanks to Professor M. Jagdesh Kumar, Honorable Chairman, UGC, for taking out time from his busy schedule to grace the occasion. With a deep sense of appreciation, we thank Dr. Rajiv Singh Raghuvanshi, Drugs Controller General of India, for gracing the occasion today. I also thank Dr. Rajesh S. Gokhale, Secretary DBT and Chairperson BioRec. Sir could not make it today for the event, but for his vision and the leadership to steer the outcomes. I would also like to extend my gratitude to Dr. Alka Sharma, Senior Advisor DBT and former MD BioRec. We are immensely grateful to our MD, Dr. Jitendra Kumar, for his continuous support and guidance. I'm particularly grateful for the trust and confidence placed in us by our bio-incubation community, and I extend my heartfelt gratitude to each one of our audience today for gracing this occasion with your presence and participation. Last but not the least, I would like to thank our dedicated team of entire BioRec family for their efforts in ensuring the smooth execution of this event. Thank you all once again, and stay tuned for the exciting sessions that are scheduled for the day. Thank you.
Thank you, Dr. Chaya. Before we conclude, may I request all the dignitaries one more time to gather for a group photo to capture this memorable moment. Once again, thank you all for your presence and participation in this inaugural session of BioRec's BioNEST and E-YUVA Conclave. We'll now break for a tea break. Thank you all. Thank you so much.
Very good afternoon, everyone. I'm Apurva Srivastav, Officer Incubation. Heartiest welcome to all of you at the BioNEST E-YUVA Conclave. Today, we are going to delve into the pivotal role that our BioNEST and E-YUVA centers play in nurturing a startup and the innovation ecosystem. So let's begin with our very first session on BioNEST Network peer-to-peer learning and experience sharing. BioNEST centers serve as a vital hubs where groundbreaking ideas are transformed into viable ventures. Through the strategic guidance, mentorship, and access to resources, our centers empower aspiring biotech entrepreneurs to navigate the complex landscape of product development, regulatory compliance, market entry, and so on. We at DBT Biotech welcome you all to join us as we explore the success stories, challenges, and future prospects of BioNEST incubation centers. With this note, I would like to welcome our esteemed panelists. Firstly, let's welcome Dr. Premnath Venugopalan on the stage. Dr. Premnath is Head NCL Innovations at CSIR NCL and Founder Director, Venture Center. Dr. Premnath is a technology developer, innovation and incubation manager, a startup mentor, and a co-founder of two medtech startups. One of his inventions is a breakthrough material for hip and knee joint replacement, and another one has been implanted in more than 1 million patients worldwide. Another technology for porous maxillofacial implants has been implanted in thousands of patients in India and abroad. In the recent 6 months, he has been recognized as a distinguished alumnus of IIT Bombay and CSIR NCL and won the CII Industrial IP Award for the Best Patent Portfolio amongst R&D organizations. He is a chemical engineer and an alumnus of MIT in the US, IIT Bombay, and has been Achieving Technology Enterprise Scholar in Cambridge, UK. Thanks for joining us, sir. Now we would request Dr. Paul Salins to kindly join us for the session. Professor Paul C. Salins is the Medical Director and Senior Vice President of the Narayana Multispecialty Hospital and the Mazumdar Shaw Cancer Center. He is the Managing Director of Mazumdar Shaw Medical Foundation focused on medical research and community outreach and Vice Chairman of ISKCON Research Foundation focused on aging, regenerative medicines, microbiome, and neurodegeneration. He is the Chairman of INCIT International Center for Innovation, Technology Transfer, and Entrepreneurship. He is the founder of two startups, CIMED, focused on drug discovery from natural sources specific for chronic disease management. And another one is MindSculpt Analytics, which is focused on advanced AI/ML solutions for analyzing complex adaptive systems. He is well known around the world for his pioneering work in facial aesthetic reconstructive surgery and management of complex vascular and skull-based access surgery. He has developed many surgical techniques over the years. Welcome you, sir. Next we have with us is Dr. Mrityunjay. I request you to kindly join us on the stage, sir. Dr. Mrityunjay is the Director General of R&D and Innovation at KIT University, Bhubaneswar, and he is the CEO of KIT TBI, an entrepreneurial professor with PhD in molecular microbiology from University of Delhi, and trained as postdoc at the Institute of Microbiology, ETH, Zurich, Switzerland. He returned to India and established the School of Biotechnology in 2007 under KIT University, which became a Center of Excellence awarded by Department of Biotechnology, Government of India. Under his leadership, KIT TBI received the Best TBI of the Year Award 2017 from Honorable President of India and the Best IP-Driven Incubator of India Award from the Ministry of Industries. Currently, he is also the chairman of Bhubaneswar City Knowledge Innovation Center Foundation. We welcome you, sir. Now, I would request Dr. Anil Konreddy to join us on the stage. Dr. Anil Konreddy is a seasoned professional specializing in industrial and agricultural biotechnology with around 20 years of experience in academia and industry. He earned his doctorate in plant microbe interactions from the University of Hyderabad, completed postdoctoral research at CTFT in Hyderabad, and published 14 international publications in peer-reviewed journals. Before joining Aspire BioNEST, Dr. Anil was a senior scientist at Shree Biotech Labs and Nagarjuna Fertilizers and Chemical Limited. As one of the founding members of Aspire BioNEST, Dr. Anil played a crucial role in establishing the incubation infrastructure. Presently, he leads bioincubation at the University of Hyderabad as COO of Aspire BioNEST and is also the member of Biotechnology Board of Studies for 2 academic institutions. Thank you for joining us, sir. Now let's extend a warm welcome to Ms. Suman Gupta. Ms. Suman Gupta is the COO of BioIncubator at Regional Center for Biotechnology, which is an academic institution established by the Department of Biotechnology, Government of India. She has been instrumental in setting up the state-of-the-art incubation facility that has supported more than 50 startups since its inception in November 2018. Ms. Gupta has been a prudent drug discovery scientist, having over 20 years of rewarding association with premier multinational pharma companies. She has led many drug discovery projects and has played a key role in finding several clinical candidates leading to the investigational new drug molecules. She is an experienced project manager and an expert in managing global collaboration. She is an alumnus of MSU Baroda and RIA College, University of Mumbai. Thank you for joining us, ma'am. Joining us next is Dr. Vishwanathan. Dr. Vishwanathan? Yeah. Dr. Vishwanathan's career is focused on supporting translation of scientific discoveries from lab to marketplace with expertise in biopharmaceutical development and grant management. He received his PhD from Biochemistry Department of Indian Institute of Science as a Marie Curie Industrial Network Fellow at the University of Würzburg, Germany. He developed commercially viable interleukin-4 protein purification method and prepared stable chemical conjugations using enzymatic methods. He also has research experience at Jackie Wood Cancer Centre, UK. Through his leadership in various funding programs, Dr. Vishwanathan has empowered 300 plus scientists, clinicians, engineers, and early stage startups that secured over 900 crore funding. He played a crucial role in establishing the MNR Foundation for Research and Innovation at Hyderabad as COO, fostering partnership between clinicians and academia in clinical research. Dr. Vishwanathan is committed to supporting biopharma innovations from India that could transform the global healthcare access and affordability. Thanks for joining us. Now I would request Dr. Premnath, who is also the moderator of this session, to kindly take over from here. Thanks.
Thank you, Apurva. Thanks a lot for this kind introduction. First of all, I think perhaps you should also tell us how much time we have. Because we are standing between people and their lunch. But I suppose they've had a fairly good snack out here, so we should be okay.
I guess 40 minutes because we are all
Sure.
running out of time. Yeah.
Sure. Okay. So, first of all, just a couple of opening points out here. This session is about some experience sharing, so I will let our colleagues here speak about some of their experiences, and it will be perhaps useful to some of you who, many of you who have just started your BioNEST journey or E-YUVA journey, and several others who I'm sure are grappling with the growing pains of building an incubator, which I think all of us have gone through. So this is actually a good opportunity, and thanks to BIRAC for bringing all of us together. Please join me in giving a round of applause to the BIRAC team for building this community. Actually, it is important. You know, the moment you can try building some of this alone, it's not easy, trust me, right? And especially when in a country where prior experiences are relatively weak, and it's important to learn from others. So these kind of peer-to-peer networks are extremely crucial as well. And, you know, I think with the size of the country and with the diversity in the capabilities across the country, it's important we leverage each other's strengths as much as possible. So in this panel today, we have an interesting mix of people. So I thought I should just point that out. And, you know, if we'll try to take some questions, and in that process, maybe get some insights out as well. We have here people who are running university-based incubators, right? University Hyderabad, also KIT, for example. We have hospital-based incubators, Dr. Paul out here. We have R&D lab-based incubators like Suman, me, and also park-based incubators like Vishu as well out here. We are located in different locations. So in a manner of speaking, Bangalore, Hyderabad, Pune is one type. The other, which is also close to emerging cities but a little maybe further away, is, for example, people like places like Faridabad, Bhubaneswar, and so on and so forth. And people like Mrityunjay have worked miracles in Bhubaneswar, and I think we should ask him about his experiences and learning. And in fact, that's something which I always look forward to, because he comes up with new ideas every time I ask him as well. We also have people from city centers and a little distant from some of these places. So IKP and for example, the BBB have a slight disadvantage that they are a little further away from a city center, but at the same time, they are able to leverage their strengths around them, right? And that's something which I would like to hear about as well. And they have identified what those strengths are. We also have people working in health versus industrial biotech and agrobiotech as well. And there are companies and incubators with a different focus. And we have people here who come from different backgrounds as well, and forming the bioincubation community, engineers, scientists, and a clinician as well, right? So it's an interesting mix, in my opinion, and I think we have perhaps some lessons for everybody in this audience as well. I'll start first by just requesting each of the participants to give a little bit of an intro about their incubator, with a focus on what, especially the bioincubator, and what exactly are some of the new things that are coming up in their incubator that they would like to tell you about as well. And some of these new ideas are some things which I think are translatable very often, and we can borrow some of those ideas as well. So over to you, Mrityunjay. I think I'll start with you. Yeah.
Thank you.
By the way, there are quite a few new incubators, so you should introduce the incubator. Is that on, please? That mic? Switched on from below?
I have done that.
Yeah. Can you just switch it on?
Anyway, I'm louder.
No, hang on. I'll just give you this mic. You can just pass it on. Yeah, sir.
Thank you, Premnath. I think, so I'm Mrityunjay, I come from Bhubaneswar, state Odisha, and today I can tell you very proudly, the geography is not a question now, where you come from. So it's not about only metros, but you can come from anywhere. If you're on a mission, you can do it. So I'm very proudly says that KIT BioNEST has been born out of BIRAC support, maybe 10 years back, and we have never looked back, because always BIRAC supports those who are performing. And why I'm saying this, because it's not a project, it's an ecosystem building exercise. And you have to create what I could call many enablers in your ecosystem. If that you are following, then things will fall. So I come from KIT BioNEST, which is in 10 years old, so far more than 227 startups out of biotech space, and some of them are doing extremely good. In fact, I was just sharing with the MD BioNEST recently, last time we had an investors meet, and 6 companies getting investments, and very hard to believe that biotech startups are getting in one platform 6 out of 10 investments. And this you have to create. Otherwise, you keep on spending, things will not happen. So 227 odd companies, more than 1,500 jobs we have created. And of course, not all of them will do good, but at least you can say 33 of companies are doing good at the moment, good valuations. And we are also growing with the companies in terms of valuation, Premnath. So we have to build the business plan of incubators. Otherwise, long term, nobody will support us. That's what KTBI built, and built, I think, one of the largest incubator in terms of employee. Just to tell all of you, we are in a KIT university, but we never look at it as an institution. We look at it as an ecosystem. 110 employees in the incubator. Imagine 110 employees in the incubator, which is really big. And that's happening in Bhubaneswar. Why I'm saying these are the positive messages people should get, because incubator is not a small organization. It can really create a big, and that's why KIT University comes forward to support us. In the span of 10 years, KIT is giving us now a 22-story building as a innovation tower, the tallest tower of innovation. These are positive messages, but in a backdrop, there are a lot of work you have to do. You have to bring clarity what an incubator is, what incubator should do. Leadership should be aligned with your mission vision, because the boss cannot go against you. So that's what we have built in KIT University, that where is the brand comes for KIT. Can the incubator bring those factors so that they will keep on supporting you? So with God's grace, with support of BIRAC and other ministries, we have grown from nothing from 2010-11, and today we have really grown big, and we are now getting best practices. Premnath-ji, we have to be generous in prayer. We should not compete among ourselves. We should collaborate to compete with the outer world. And that's what I see. Go to Bangalore, go to Germany, Switzerland and all. They talk about others, their competitors. They never talk about only themselves. In our ecosystem, we have to build. So with that, we are now going into several parts of East and Northeast, setting up some of the hubs with the partnership. And those are not belong to KTBI. Those are belong to them, but we are enabling it. So we want to play that role, and that's what we are growing and growing. And if you be generous, if you are collaborating, you will grow much better as compared to working in isolation. That's what the message I can give all of you. Thank you.
So good morning, everybody, and thanks to BIRAC for giving this opportunity. So I am from Aspire BioNEST, which is a university-based incubation ecosystem, and this is a specialized incubation center focuses on life sciences, in and around life sciences. And this is a deep tech incubator, and we don't believe on virtual incubation. We only offer a physical incubation, and this is spread over around 25,000 SFT, and provide kind of end-to-end facilities to the startups, incubating startups. And we are slightly more than 6 years, and we were inaugurated in 2018. And in the past 6 years, we supported 64 startups, all are deep tech startups, and 32 being incubated and 30 moved out, successfully graduated. And startups and by the incubation center together, we created a little more than 500 jobs and trained 600 interns and filed 75 international IPs. 30 products have been pushed into the market. And collectively, they have raised a little more than 150 crores of follow-up funding. And proudly, I say that with the help of other BIRAC, BAG partners, we have a 15 BAG awardees on the floor. So this is about the BioNEST.
Good morning, everyone. And first of all, congratulations to all of you. This is a job, actually, the CEO of a BioNEST job is like, you literally have to run to stand in one place. Things change, applicants change, you have to keep yourself. With this, I would like to introduce, I am Bisu. I take care of grant management and incubation at IKP Knowledge Park. In 2017, actually, I came to first BioNEST Conclave, thanks to Dr. Satyadas, who invited me as an observer. So when I was coming back from UK, it's nice to see the transition in the 7 years. In IKP, as Dr. Premnath mentioned, it's a little far away from the city, but it has its own advantages. It's a 200-acre science park. So everyone is talking about incubators, but this is a science park with 9 of its own incubators, with a 4 lakh plus square feet built up space across the incubators and the Genome Valley. So the advantage for the innovators are the small, large and very large companies come, there is a ready-made space available, they can operate at scale. And mainly for the innovators who come to IKP, they are in a co-localized in a same place where large companies are present. So we heard that industry connect is a problem, so that actually instantly is solved. But from a single person teams, it's a complex thing. Over 25 years, in 1998, it is established in the Genome Valley with 200-acre campus. So around with 100 crore support from IKP, the companies that IKP supported were able to raise around 3,500 crores. It's almost like a 32x return. It's not the return to IKP, but for the innovators and the companies supported by IKP. Just to mention, the earliest incubator of life science incubator of IKP is the Laurus Labs. They came in 2008 or so, and 2014 they went to IPO. So in that way, the science park has its own advantages for large companies. in terms of the innovators, IKP has several grant programs. IKP is one of the BSc partner, and proud to say that 13 of the BSc awardees are there in the University of Hyderabad. And we collaborate with all the BioNES who are around. In Hyderabad alone, there are 80 plus incubators are there. So we don't compete with any of them. So if somebody is there, we try to find actually literally next to their house an incubator in Hyderabad. We can do that. So that way we actually have a large advantage of working with all these, not just Hyderabad, but I'm just taking an example since we are physically located there. And as CEOs and many of you might have come from your backgrounds to this newly. So always look where you can partner with them and work together. Good luck.
Yeah, thank you. Vishu, can you hear me? You able to hear? Yeah, fine. Okay. Yeah, I think over to you, Suman. I think you can continue. Yeah,
Thank
now
you.
it's good. Yeah.
Thank you,
Well,
Dr. Vedant.
one thing I just should point out that as a park, you have ample space to scale, and also, the operations can be scaled at a much larger level, which is a different model. So I'd request you to also speak about that at a later point of, compared to a pure play incubator, Science Park has its own, interesting aspects. So Suman, over to you.
Thank you. And first of all, I would like to thank the BioRec team for giving this opportunity, yet another opportunity for peer-to-peer learning. And it's been 6 years that I'm managing the incubator as a CEO, but even till today, I have a lot of things to learn from the peers here. So I come from BSc BioNEST Bioincubator, which is located at Regional Center for Biotechnology. So, which is in the NCR Biotech Science Cluster. So the cluster actually has presence of 5 institutes: RCB, THSTI, NII, NBRC, and NIPJR. And so the cluster also houses the incubator, which is managed by RCB. And the cluster specializes in life sciences and allied areas. So hence, we picked up life sciences-based startups to be the focus of the incubator. And we've supported around 50 startups in the past 5 to 6 years that we have been operational. And we have about 20,000 square feet of area which is dedicated for incubation. So our startups can find anything from basic equipment to advanced equipment to a BSL-3 facility or an animal house to execute their ideas into a commercially viable entity. So I think as we go along, I'll talk a little bit more about the advantages and disadvantages of being associated with the host institute. I think with that.
The host institute, I think you have to speak more advantages.
Yeah. I can talk about both because I think in the new incubator there would be some people who would be like us associated with the host and not a Section 8 or a society. So we can talk a little bit as we go along.
Sure, thank you. Over to you, Dr. Paul.
Yeah. I must say that I am somewhat slightly different from the whole situation because ours is a hospital-based incubator. And we are the first hospital-based incubator to start. The issue started because Narayana Health, Narayana Hrudayalaya has been an innovation-driven medical enterprise because we were the first one, Dr. Devi Shetty, bringing down the cost of cardiac surgery. And that needed a lot of innovations and organization. And going forward, we became multi-specialty, incorporated a cancer institute, and then we set up a large molecular research facility providing all the molecules. So the only wing, then I realized that just having these components within the ecosystem is still inadequate because technology was actually coming into play. And we realized also that the future of healthcare is not hospital-centric, it is personal and individual-centric. And the focus of change that is going to take place is going to be in radical different areas because in the diagnostic capability, the way of AI, computation, material sciences, and so the expectations that we can actually form in terms of outcomes can be significantly raised, and that will provide a amazing. So essentially, what we have really tried to do is that provide finding space within the hospital is an unbelievably difficult task because it's all allocated for patient purposes. But still, of course, we have more than 10,000 space. but we can talk afterwards how we have incorporated spaces within the hospital for the people to use. But most importantly, we have an ecosystem where an innovator can come and get ideas. And we have more than 100 doctors who are very happy, enthused about innovation, who will be able to communicate with you. You also have the whole mindset of people who are constantly looking across the world to see what new technologies to bring into the healthcare. And also, unlike a strict corporate one, here we have a tremendous focus on affordability so that everybody gets. So unless a solution is affordable, we say that it is not really a solution. So this produces a certain energy in our setup. And so we have set it up to provide from innovation all the way to implementation, a complete setup in healthcare. And our hope is that by providing molecular research and all these things together, we will be able to get some ideas which will actually percolate towards the game changes in healthcare, and we want to be stakeholders in that. That's basically our story.
Yeah, so briefly, let me just tell you about Venture Center as well. We are based in Pune and in the National Chemical Laboratory campus. We are, if you look at our bio incubator, I'll just keep the focus on just a couple of things. We host almost, our incubator hosts almost 80 plus resident startups at any given time. So it's a fairly large incubation activity. Now we have a team of almost 65 plus people. But when we started in 2007, of course it was an abandoned campus with 2 people visiting there every now and then to make sure things get started. So that's how we got started. So the journey is, in the initial periods, is fairly tough for many of us because we are trying to understand this whole idea of incubation, of how to build a pipeline of startups, how to support them, how to create or find resources to take them ahead to the next step, to find mentors, to find a pool of entrepreneurs, to educate some of these people, train them, create awareness, and at the same time, manage, in a manner of speaking, their mental health as well. Because, startups are, it's not an easy journey, right? We have to do all of this as well. I'm also going to pick on a few things which Jitendra mentioned in his slides as challenges, because those are really the burning issues for most of our incubators, and I think we should cover that as well. But before that, just a few things on, unique offerings or what one can design. So in biotech and biomed and, working with various different types of biomass, agriculture and so on, you will find that there are so many sectors, and in each of those sectors, one of the key tasks of incubators is to somehow get a company investment ready, right? I'm giving you a simpler statement of the task. It's not simple in how to do it, but it's a simpler statement of the task, which is how to get them investment ready, right? And how to get them attractive for investors in an economy where investors have other investment opportunities as well, right? It's not that this is the only thing available to them, right? They could go and shop around, just like you shop around for fixed deposits and interest rates and so on and so forth. They can also shop around. They'll go for the IT company out there or the logistics company out there. They don't need to invest in a biotech company, right? So if that is the case, how do you get them interesting and how do you get them attractive? And I think we have a role to play in building the ecosystem for that in terms of taking it as far as possible. And typically the venture center approach is that we think of it as, crossing a lake and the stepping stones missing, right? How do you fill up those stepping stones? And which lake to cross, where it's possible to cross, direct entrepreneurs in a route that is easier to cross, perhaps, and at the same time, get them across. So in Venture Center, a couple of unique offerings which we have tried to build over a period of time. One is in the medtech space. We can go from proof of concept to prototyping to regulatory consultation to even a clean room, which is ISO certified, ISO 13485 certified for doing clinical trial samples. And that we found as an important need because people needed that to be attractive enough to raise money. Otherwise, investors are not ready to invest in a trial manufacturing facility for you, right? Similarly, with thanks to BioRac's support, we have also recently in the biopharma space tried to build a GLP compliant facility which allows for analysis for biopharma molecules. Now that we saw as a key gap area for people in the biopharma space. I do realize biopharma is very tough in India. It's not a joke, but that said, we feel there's a need to do it. You know, in the sense we must be there in the game and not leave it behind. So on similar vein, I thought perhaps I can request each of you to talk about it. For example, in the hospital space, you did mention that ideas need identification. But then there's also validation, right? There is also access to samples, data, clinical data. There is also access to certain unique facilities for testing, validation of those kinds, besides clinical validation. Do you want to talk about those and how you are making it available to startups? And then I'll request the same of each of you, please. Suman, you can also talk about those facilities at RCB and so on. I think you can take this. Let me go with that.
Yeah, actually, what we have done is that any innovation that actually comes to us, whatever is the needs that are there. For instance, some innovations that require a microbial certain resistance pattern. So, one of the great advantages here is that we have the laboratories, GLP compliant facilities, and so on and so forth. And there is already ongoing research, let us say in cancer or in material development and it is. So what we can do is that very often these people, when they come to us, we are able to refine their approach to doing it so that, because we know what will be the necessity in the healthcare space. Very often ideas, one example is somebody comes with a cough insurance. They have actually targeted for some very exotic, but probably have no market value. The first thing that we are able to provide is work with them so that that particular technology can be utilized for something which will at the first level have maximum appeal. So that, it can become, as Dr. pointed out, something that somebody will fund so that it can take. So we are able to provide that facility. Secondly, we created all these wet labs and also the electronic prototyping facilities. So anybody who comes with an idea, we can help them develop a preliminary module and guide them through how it can be taken through the ethics committee and taken to clinical validation. Many people actually come to us because we also have, since we have 25 hospitals access, you have an understanding of what will work, what will not, because we will be the end users. So the advantage institutions such as ours can provide is first and foremost, it can help refine any of the ideas and sometimes actually guide you with regard to how best to face it out in the first place, so that in terms of investment there is a clear-cut corridor. And very often we also will be able to help them bring about certain other technologies, so that when it is combined with another technology, it becomes doubly powerful. In fact, we are able to do that because we are dealing with multiple technologies at any given time, so that we know what will be a probable one which will actually connect together. Then, of course, how it can be, the processes, the legal process can be, compliance can be actually worked out. So these are the steps. So essentially, we guide the people through to the entire process, and will be able to particularly provide them clinical validation. First, probably a SNP trial, then probably how to position. And that we are able to do because we have connection with more than 20 institutions in different tier cities. So what probably in a very sophisticated sector is not possible. You can start off in a university setup and bring it up to a higher level of doing. So that's more or less our approach.
Sure. I think, Suman, you have a lot of advantage being in the NCR cluster. Maybe you can talk about that. Yeah, I think. Can you hear?
Yeah.
this is working now. I think they are probably managing it from there. That's
So yeah, definitely being in a cluster is very helpful when it comes to sharing the infrastructure. So whatever infrastructure that the incubator has created through the BioNEST scheme is available to the startups, as well as whatever infrastructure is available at RCB or THSTI. So all that is made available to the startup, and it comes very helpful in their journey. So we also have an Advanced Technology Platform Center, so which is a different project by DBT at RCB, so which has all the high-end equipments available. So that is offered to the startups at a subsidized rate, so which becomes a very huge, big advantage because they get all those facilities right in the same center. Apart from that, another big advantage our startups get is opportunity for collaboration, because we have both the institutes who have a different expertise in different domains of biotechnology. So if there is a need, the startup can collaborate with the faculty member or take their advice in troubleshooting, etc. So that's another big advantage which our startups have. In addition to the BSL-3 facility, the animal facility, which can be used, while collaborating with the faculty. So those are all the major advantages a life science deep tech startup can get from the cluster.
So I think your industry networks are fabulous, and then also around you, there's I think such a cluster of industries as well.
So regarding the scale up and why the companies that came to IKP, the reason and why they are continuing to come. So I'll just take few examples of the companies that are in the IKP Knowledge Park to give an idea. Starting with Laurus Labs, which I mentioned. As of today, they have 3,000 employees across, and in terms of impact, every second retroviral drug manufactured in developing countries, every second drug comes from their facilities. They have manufacturing facilities elsewhere. IKP being a pilot, so they develop the technology, R&D, and the transfer technology to the manufacturing plants. And coming to the companies like US Pharmacopoeia, so that is the first facility outside US for the reference standard. Earlier they used to do with only small molecules, now they are doing with the biologics as well. These kind of companies, what they look, can they save time? Can they start operations on day one? Do they have to go through the red tape? So when a large company is investing, they look at time as well. So they have funding, that's not a major constraint. But when they start looking at operations and flexibility, and thanks to Hyderabad, it has excellent road facility. So from anywhere in the city, they can reach Genome Valley. Despite it being 70 kilometers, they can reach within 1 hour. So these companies, when they start operations with 4 members, and they look at the feasibility, within no time, they realize that it's the best place. And such companies, 4 to 6 member team convert into a 300, 400 members team. And being a science park with the land available, so we allow these companies to continue there. So these companies who are coming for a test facility to use the ready-made labs available, they continue to build while building their business and the resources. And companies like Dicel Technologies, Dicel Chiral Technologies from Japan, so they look at the compliance, how the science park or the place where they are, is it wholeheartedly following, and they are actually much more serious than a regulator. So the internal compliance of the Japanese companies is much more than the actually the regulatory audits. When they're building facilities, their internal approvals and regulatory approvals within the company is much more complex. So being in such a place, if you are complying with all these things, the companies, these kind of quality companies that are coming to the park, they will help the small and medium companies coming to the incubator or the ready-made space available. So basically the science park helps these large companies to come, having an incubator and place for the small to medium companies to be there. If you have heard the example of Laurus Labs, when they are expanding into biopharma, they have invested 240 crores and now the Rich Core Bio is known as Laurus Bio. So these kind of productive interactions can happen relatively easier because they are co-located. Some of the BIZ awardees, when they start looking for the industry partners, being within the Genome Valley, the company can come to your place and they have much more knowledge than just what you are presenting in a PowerPoint. So this actually the co-location of the large companies and small companies and having the knowledge of how you are working really helps the small to medium companies in terms of establishing that scale.
And also, ImmunoAct, right? How?
Sir, please use mic.
Yeah. I'm not sure this is working.
Yeah, it's working.
Yeah. So Loris is investing in, for example, ImmunoAct. That itself is a great example of collaboration. And the question is, how do we build many more of them? And of course, it's you need to have these larger companies also in many domains to have success rather than just looking at smaller companies alone. And sometimes it's an ecosystem play. So thanks. Actually, that's these are good points actually that you have brought out about that ecosystem. So my point was just to illustrate that there are strengths in every ecosystem, and the idea is to build on those, right? So let me move on to Anil and Mrityunjay. We may not have time for too much in terms of the other points I wanted to cover, but what I'll do is I want to pick up one or two challenges which people face soon after this. So after you, I'll come.
So when it comes to the offerings to the startups, I think we slightly overlap with RCB. So when you consider School of Life Sciences or School of Chemistry at University of Hyderabad, they always stand maybe in the top 3 positions in the country. You name any corner in the biology, at least you'll find one faculty working on that particular problem. And the advantage for the incubating startups would be, I think they'll be readily connected with the faculty members, so they can collaborate, co-develop, or they can sponsor research projects to the faculty member. And if you look into the interest coming from the faculty, we have, as I said, 60 startups. 25% of them, like 14 of the startups, have a faculty member as a founder or co-founder. This is the biggest strength, and this is how we also create the pipeline. And when it comes to the unique offerings, what we give it to the startups, we may not be comparable with the scale of IKP or a KIT, but at our capacity, we do a couple of things. To start with, we have something called Aspire Network Cafe. Under this, we'll invite one industrial expert once in a month. So this is a discussion over a cup of coffee, very informal meeting. So the startups can throw any questions to that industry expert. Industry experts in the sense from Reddy Labs or Bharat Biotech or Newland Labs, something like that. The people who have proven themselves in the industrial scale. So the startups can throw any question. It could be from a finance, it could be in the regulatory, it could be from the development point of view. They could informally interact with them to get insight of their particular problem. This is one thing we do. And the second thing, we have something called a special advisory meeting once in a year or once in a half a year. We call for this meeting. And a group of people like serial entrepreneurs and investors and even including academicians and proven industrialists, they're part of this committee. And they keep visiting us. They spend good amount of time visiting each and every incubating lab in the facility. So the startup on one-on-one capacity, they can interact with the committee members. So to discuss and get best out of their expertise. These are the couple of offerings we are giving it to the startups. And
sure.
Yeah, I'll just pass.
Over to Mrityunjay, a couple of things which you are doing, which is
60 seconds.
Yeah, but after that, can you also talk a little bit about how you build incubating pipeline? And of course, I've seen that you've done very well with CSR as well. So I wanted you to talk about that when you talk about how you're leveraging your ecosystem, but also about how you build incubating pipeline.
Yeah, as many of them are young, I think the beginners in terms of BioNEST or E-YUVA, I think these offerings are very different, high level. The first offering, I'll be requesting all of you that whoever is coming to you, talk to them properly, on time, on the spot. You cannot be a led-by culture like a professor says, come back after 1 month. So this is what I find in many, I cannot comment on those everyone, but this should be happen. Incubators should behave differently as compared to academic organizations. It means today, you got an email today, somebody asking you some sort of help service, just respond it. Not just thank you for your question, I'll get back to you after 1 month. It has to be today, get connected. Like you cannot have all infra or all sort of expertise within you. Can you connect somebody to the other person so that the person should not feel, no, nobody is looking after me, nobody is saying, that's what the job of BioIncubator. Now that offering we do very smartly. If you send, just try that today. You send an email to our incubator, you'll get a response. I'm sitting here, or Dr. is sitting here. Somebody else will respond to you. Please wait, maybe by evening you'll get a response. So that's what you want to operate, smart operate, on time, on spot. Second, the good offering, what you've been doing today, very famous at the moment, very popular, that the paid pilotings, validations, and deployments. because startups are growing to a level. After that, they are left out because incubator cannot support unless until you think differently. So how do you build? That's what Dr. Jitendra mentioned about industry connect is missing. If you really talk to them, they have a lot of problems. They want solution, but they don't want to solve it, and somebody is already solving it. So how do you connect them and do a paid pilot? And they pay more than anybody else because that's their pain problem. There we have been very popular. In fact, we got a lot of money out of those things because we also earn out of it. And bigger companies have problems. We bring startups to solve them. They've already solved it, but they repurpose it for their things. So you get some amount of money. The other one is make your laboratories certified laboratories. So we had done something on the NABL part, and believe me or not, that will attract a lot of industries to come to your campus. You cannot invite industry, please come to incubator. I have been funded by BioNEST. Nobody comes like that. You have to show them the content, the context, and once they start coming, you're adding values to them. They start looking at your startups also. So if you really want to bring this kind of ambience, build the industry-driven laboratories, which are required for our startups for certification. Same lab equipments you have, but again, the R&D style. But if you really make them certified-based platform, I think more and more startups will come to you, and also it will help them to get into market as faster as compared to others. That's what I think our offerings are. And with NABL Lab, Premnaji, not only we are earning money, but we are getting bigger companies coming to us, looking at our facilities, looking at startups, helping them to go to next level. And they also can put money in this company through CSR also. Thank you.
Thank you for bringing up the point of back to basics first, right? I'm getting a signal that I should open it to questions. So I should open that. How much time do we have?
2 minutes.
Okay. So let me just take a few minutes to request each of you to address two important issues. One is pipeline, okay, and the other is sustainability, right? And sources of funding and income for the incubator itself. And I'll request you to be brief, maybe a couple of minutes, and we can each move through it, and then I'll take the question.
So build pipeline is very simple. We are not sitting within our four walls. We reach out, we go everywhere. You can see yesterday I was in Lucknow. Today I'm here for some other purpose, not for incubators, but I'll be traveling to Mohali, traveling to Tripura, So you cannot sit within your incubator and say incubators will come to you because you've never done enough branding. You've never showcased what you can do. So you have to reach out. So your plan has to be outreach. Planning has to be very, very strong if you really want to populate your campus with many startups. Second, offerings. That is very, very important. If you showcase them, these are the offerings, they can grow from A to B, they will all come to you. Because very few places I've realized, I'm not commenting about all, that these offerings are missing. There is very disconnect between what you can offer and what the person needs about those offerings. So I think there you reach out places, run cohort programs. Let's say you run a agri cohort program, so you can run for a, let's say, access to potable water or the waste well program. You get very good startups, innovators coming to you as a prospective startup. So we are doing now a very cohort-based program, which is giving us more result as compared to a general programs to look for 100 you reach and you get only one. Here you reach 20, you get at least 15, 10 of them are becoming your potential because they are very matured ones coming on the cohort program. And what else? Sustainability, I should not say because the BioNEST is here, but to be very honest, proudly I can say, I'll not tell the number, but I can say we are sustainable, truly sustainable. 100 members, 110 employees and all expenditure, we give all sort of our bills, everything, it comes in crores, we are sustainable. Because our business plan is very strong. We are not looking at rental as a model of sustainability. We have a transactions of sustainability. They said if we do one assignment, which might happen very soon, we might get in one transaction 5 crores. It's a profit which comes to the incubator. I'm not disclosing everything because many things are not to be disclosed, but offline we can discuss. You should have 11 pointers which I know that I can discuss with you later on, where you can earn more money as compared to, don't focus on rental. Rental should be the lowest. You attract them and then you take from them, right? So, and bring a lot of values. Because see, initially you cannot say I am charging 200 rupees per square feet. The person is saying, oh, it's too much. So look at them where you can add values and bring mostly paid piloting, because the person who is doing piloting or funding for pilot, he is willing to pay to the incubator a charge. And these are much more than the incubation charges. Or for example, some of the other programs which I'll disclose later on one-to-one, that don't look at only instrument usage charges as can it be a Nebula lab which might give you multi-crores, not as instrument usage charge, because there is very little you get. So if you cannot ask them more and more money all the time. So if you really look at sustainability, you have to see yourself as a startup company, look for business plan, growth plan, investment plan, donation plans. Let's say, once somebody is giving us, let's say, 10 crores donation. Good, just like incubator funding. Now, how can you pitch for those things? I think look at your approach to be 360-degree approach. Cannot be only government funding, corporate funding, international funding, and even I'll tell you the bureaucratic funding. Go to your district collector. They have fund called District Mineral Fund, Development Fund. Do you know how much it has? In my state, it comes to 3,500 crores. And they are saying, please bring us new innovations in access to potable water, renewable energy, and they never talk to startups. Now, how you bring that, and this will be more than sustainable for you. So talk to unusual people, not only talk to Premnath, me or BioNEST or DST. Go to them and meet these collectors, bureaucratic fund. They have a lot of money to offer to an incubator because you're a Section 8 company. You have the biggest strength. You can get donations, you can get funding from government to do a lot of exciting things, and through innovation, affordable innovation, what can I say. I think this is what we have done, Premnaji, doing quite good.
Thanks. Those are very valuable inputs.
Yes, when it comes to pipeline, am I audible?
Yeah.
Yeah, okay. So when you look into the pipeline activities to create your own incubators, I think the University of Hyderabad is one of the first university to start something called Faculty Enterprise Scheme, where the policy document, it allows the faculty members to spend some part of their teaching time on entrepreneurial activities. So that is the first thing. And the second thing is a concept competition-based pre-incubation program, where as per BioNEST offers a problem statement to the students, and the students come up with the solutions. And there is a committee to screen and select, and the selected ideas will get a free space, access to all the instrumentation, and some money to meet the expenditure to execute the idea. So once they are successful, they become our incubatee. This is the second pipeline activity we follow. And when it comes to the offerings, when a startup looks into multiple option of incubators to come and join, so they look which one is offering a comprehensive services, so where they don't have to look into the many of the incubators to run around. So in that matter, thanks to BioNEST, so we could establish a kind of very comprehensive facility, so where a startup could handle almost all the life sciences or biopharma experimentation. You name a upstream processing, you name a downstream processing, clean rooms, culture facilities, we could establish within the lab capacity. That is very important for the upcoming. So if you have one or two of a super specialty, a super expensive instrument, that may not do the job. But if you could provide in and around whatever they are looking at, so then it becomes easy for you to catch out the many of the startups. And when it comes to sustainability, maybe we are really young compared to the kit. So right now we are operationally sustainable. We are just 6 years old, and majority of the revenue comes from the license fee, what we call it as. And remaining, we get some little amount of the CSR funding, and we depend on grants. And we also charge a bit of a licensing charge for raising some grants and funding to the incubating startups. These are, and right now we are operationally sustainable. And being in a government-based academic institute, it's really difficult to convince the management to contribute to the incubation ecosystem. So right now we are dependent on only the incubation activities as a revenue source. Yes.
But government institutes do put in-kind contribution.
Yes, when we started this, when we applied to the BioNEST Center, University of Hyderabad was really generous. They gave a close to 25,000 SFT built up area. But now, for the past 2 years, we are running with a 100% capacity. So there is a lot of demand and many people are in the waiting list. We are unable to meet their demand. And even the incubating startups also, they need more and more space as they grow, but we are unable to provide. So that is a little tricky part actually.
Yeah, sure. Visu, one more thing I just wanted to briefly ask you is, you're one of the 3 incubators who have set up a venture fund, right? And I registered venture fund. So briefly, if you know about it, you can say whether is that a good thing for an incubator, even for sustainability?
Okay, there are 2 things regarding the pipeline. For a science park, actually, the brand is very important because you have customers who may not be physically there. Thanks to our CEO, many of you would be familiar, Deepanvita ma'am. For 25 years, she has built a brand and a team that is able to attract companies, not just from India, but from every geography. So this brand helps. So when you are working, wholeheartedly you work, and the incubators who come to you are your ambassadors. And many of you are so much hesitant to post. I see there are 95 incubators, but very limited people actually come back and post in LinkedIn, Twitter, and other things. Since some of you will be just starting, make it a habit at least to post the program, because relevant companies, somebody may be just next to you, they don't know you exist. And coming back to venture fund, so this is the India Innovation Fund IKP has established and exited successfully. For an incubator, having an investment fund is very helpful. We are talking about sustainability. If you have a team that takes care of the investment, as an incubator, you can actually do the consultancy projects as well, not just for the small companies and incubators. The team actually can do the multiple things. So in terms of revenues, as everybody is saying, the rental income is only a part of it. So if you can build a team around all the startup related activities and funding, if you have strength in your team who can actually add value to the companies that are coming, or even who is coming for consultancy, that adds actually a great value. And from IKP's experience of Start Fund, Leap Fund, IKP own funds, for example, ICO Fund, during COVID time, being a private organization, we have liberty to start very fast. Within 2 days of the COVID lockdown, IKP was able to announce a own fund. It's called ICO Fund. There were 23 companies were supported, and hospitals were connected. And thanks to BioNEST, actually, they immediately called after the call. They said, this is amazing. If you're able to do it in 1 week, announcement and acceptance application. So when you have a fund and when you're addressing a very specific gap, I had seen actually MicroGo team, Rachna is also there. They were able to go to the next level. During COVID time, being a science park and we have a slightly better connect, we were able to help some of these companies to procure limiting factors, like some things take much time. So we actually gave 20-25 lakh rupees instantly so that they can procure those things. And thanks to Doji kind of companies, they were actually able to raise a 200 crore plus investment during COVID time. I think having an investment, so we were talking about returns and all. I mentioned that IKP received a 32x in terms of the innovators and companies receiving. It helps your team to be sustainable. It helps you to have a consultancy and other support projects. Certainly, you must all try for having your own funds if possible. I am sure in some cases that your institutes have excellent strengths. You should make use of those things.
Yeah, just 30 seconds. So for the pipeline, our startups are the best ambassadors. So they talk about our facilities, and that's how we get the next lot of startups. Apart from that, we do some social media engagements to roll out our calls. And we also conduct some idea competitions like how Aspire also does. So those are basically the winners are given free incubation space. Plus, we also connect with some universities to have a pre-incubation program. So we do a collaboration with them. And if they have any students who have some good idea or faculty, so they come on the campus, and that's how the pipeline is built. So regarding the sustainability model, we are operationally sustainable. But yes, lot to learn from Dr. Mrityunjay. So I'm taking back some points today.
Yeah. For us, the pipeline primarily is that we have a lot of people coming for clinical validation. both in equipments and sometimes, and we have a very streamlined structure. We can provide clinical validation and also in terms of how it has to be brought into the market, we can provide them very valuable insights and also provide them help. There are a lot of people who are, because our own people who are actually getting the equipment and so on can advise people. So that is one great value. And secondly, we also have a lot of collaborations. We have, I think, 70 MOUs. Mr. Bhupala looks after this. So we have a number of collaborations where people are all interested in solving one problem or the other. So that is another way in which we get it. In terms of sustainability, we have been actually using the Seed Fund India to give funding to the people. But we are also thinking of developing a corpus going forward because it will help us specialize into certain things.
Yeah. As a not-for-profit, actually, you should keep in mind that there is an opportunity to build a corpus as well. And in hospital environments, we have seen in the US that there are many grateful patients also who contribute to some of these kind of funds as well. Anyway, just a couple of quick questions. If people want to ask questions, can I request any hands up? Yeah, there's one there. How do I get the mic there, please? Can I get the mic? Yeah, please. Maybe I'll repeat it. There's mic coming. Yeah.
No problem. I'm from IRAC. Just one question is that while we are having a roller coaster of sustainability and funds coming up, is there some internal mechanism where incubator takes a breath back and analyzes its own technologies and says, is there a course correction? I mean, is there a matrix which any of you can let us know that? Is there a matrix of incubators, or is it like whoever comes is supported to a certain extent based on a certain mandate, or there is a a mechanism where you are looking at it and saying, okay, this is the matrix of XYZ factors which I have looked at, which I have analyzed the people I have incubated, and then where are they, and then do I need to have a course correction? Is that something which is an incubator does?
I can comment on it, but anybody wants to comment first? So, we do have a set of, there is a strategy document which lays out what exactly we are aiming for in the next 5-10 years. And one of the key things you have to think about is what impact you want to deliver and not just the output. So I can incubate a company, but what comes out of it? What is the overall impact you want to achieve? So for a venture center, for example, we would look at, one of the things I told you is getting them investment ready. So we do look at what is the kind of risk capital that these companies are attracting as one of the key impact parameters. I don't mean just this is going ahead. It's important because you have to realize that all those funds could have gone into something other than innovation, right? But people are putting money in innovation, and that matters in as a whole, as a society, because that produces the product services. A lot more investment happens than what we do at the early stages in terms of grants, activities, and so on. But another important thing is also building clusters, building mechanisms by which it auto-catalyzes, not just, you realize that maybe 10 years back, nobody would come to Pune for a biotech startup. Like investor would not look at candidates, Today they would come looking for opportunity. That happens only if you have a cluster. It doesn't happen just because you have one stray company out there. And so that cluster effect is also important to make that happen. And of course, in terms of the social impact that you have and so on. So we do look at those, but it is not something you can do immediately. It's a strategy where you connect your outputs to your impact, right? Your immediate outputs are number of startups and all, but the impact has to be connected. And that doesn't happen in 1 year. It happens over a period of time. Over to you.
I think, looking at the question sustainability of incubator, first of all, you have to be smart enough to understand that how you are not, let's say today I got a BioNEST. I should have done some homework before. What are you going to start with, right? What will be our major, domains and all. So Plan is establishment plan, which takes some time. It should be very clear. This is very, what you call, flexible time where you can do a lot of experiments. You might fail, but in long run, you cannot fail more. You can fail less and succeed more. Second is your development plan. The third is growth plan. So today, what I said in terms of development establishment, we are sustainable. How much we are spending, earning, good. But next plan is growth plan. So the growth plan is beyond what we have done so far. That's like people are talking about manufacturing. How are you helping a cohort of startup in your region getting into a manufacturing zone? So if you are an incubation leader and you want to build sustainability, bring a business plan in front. Every 3 years, what you will achieve. Where you have failed, plan B comes in. You have to also work as a company. Otherwise, you will keep on spending, but you will not have a growth plan afterwards. So that's build those establishment plan, development plan, then growth plan. This has to be part of your implementation program. That's what I can say.
I don't know, did that answer your question?
Actually, I was just asking, is there a matrix which you assess yourself with, and is it something like, I've reached here, these are the startups? But yeah, I guess it's not only...
There is no textbook language for that, to be very honest. Everyone is different, company is different, incubator geography is different. So models will be different kind. I think...
Actually, that's the most honest answer. There is no matrix existing.
But for a not-for-profit company, right, financial sustainability is required, but it is not enough to justify that not-for-profit company. It is always impact, right? So you have to have impact metrics. There's no two ways around it. But it's different for different organizations. If I survive very well, I grow financially, but I don't have any impact, then I don't have any place in society. I mean, I should be a for-profit company. Right?
Once you make profit, you can show impact also.
So you have to
Guys are sitting up at one end, but you have
he's
different
being practical. I'm just telling you that impact is the thing which you have to keep on the agenda as a board. So every board of such not-for-profit has to keep that on the agenda. Dr. Narayanan, you had a question. Can I just pass on the mic? No, I think it's coming to you. Please.
How do you look at equity participation in the startups as a means to sustainability? Anyone or all of you can address it.
Okay, give it briefly because
Mrityunjay might have the most experience and Vishnu as well. My take is this, that it doesn't help your cash flows. Okay? So we never...
It happens in just.
No. So when you're establishing incubation operation, we don't count it in the calculations at all. Okay, because it is unpredictable, it is not something you can rely on, that's not something on which you base your organization. But, at a later stage, right, it may be possible to get some returns which builds your corpus as a not-for-profit. Okay, but that's something which we call it a kicker of different kinds. Like this one type of kicker, there can be others, but it is not something on which you will build a stable organization. I mean, as far as a not-for-profit incubator is concerned. But maybe...
No, I think we have good stories. I can disclose those things because it's already in the news. So definitely there you have to also understand many of them will fail giving you back money. With that note, if you say as an incubator, if you have your structured system to invest, taking equity, if at least a couple of them become good, you get a lot of money back. But there's a question there. If let's say I'm spending money or putting money or BioNEST seed fund, leaf fund in some company, got 20x return. What it means, some part, all this part of the money will be going to further investments. So we'll grow in that term of investment, but we'll never see the money coming us to do whatever we want to do, right? To build a building. Because this money, whatever the X money you get out of this investment from leaf, seed, or even DST, seed fund, startups, all money will go back for further investments. So even though you have, let's say, 130 odd crores there, we keep on investing on people. So many of them we have not realized, but at least 11 exit we have taken and got some money, good money. And we have now multiple rounds investing on other companies. That's why our portfolio of investment going up and up to 75 companies, where maybe initial fund for the government had come from maybe 30, 35, 40 of them. But later on we got some money back. But never will see that money when it comes to us in our account, 100 crore exists. because it has to be reinvested. That's what the whole rules of the LEAF and seed funds are.
And in general, the US experience, if you have to look at, there is a base level growth that happens because of income from all of these sources, and then there are occasional peaks that come. A TTO, typical tech transfer officer incubator in the US university, will always rely on the base, not these, right? And that comes for very few. So as a general thumb rule, you should not rely on it as an early stage incubator. Maybe at a later stage, you can have some ups. If there's one blip, then you have a chance that you can build something on top of it.
Yeah, but Prerna, those are very nice blips to have. Right?
Yeah, they're very nice
They have
blips to
huge
have,
impact. So,
but the odds of it are very low.
yeah, but you are aiming towards that, right? So you'll have to put it in your equation saying that maybe year 2, year 3, I can count on this 10%, 20% or something.
No, not year 2, year 3, definitely, especially in biotech, right? It's much longer and the risks are much higher as well, right? So you have to factor that in. So that cannot be a business model, in my opinion, for an early stage incubator. It can be, and one more risk you run is the moment you do this, slowly you start gravitating to the other end of a tech spectrum. That means you will start taking less and less risk, because just like you're like a VC, right? Why would you invest very early? You would go and invest much later where the growth is much higher and your risks are lower. So I think everything has its place. The not-for-profit incubator has its place. A VC investment fund has its place. We shouldn't confuse them. They're not the same. That's my view. And Mrityunjay might differ on that.
I may also differ on that.
Yeah. Any other questions? Final questions? Apurva is here. Otherwise, we'll request, we'll close on that note in that case.
I think you may want to look at some of the examples like the Tel Aviv University, which has got an incubator called Ramot. I had the privilege of being on their advisory board because of an investment from the Tatas. So they run an incubator and they run an equity fund, momentum fund it used to be called at that time. And they mix generating resources, as you rightly said, it is not for, it is a non-profit, so nobody takes away those resources, it is invested back so that you can expand and create a much better ecosystem. You may want to look at that, you can search it out, Ramot, R-A-M-O-T.
Yeah. But please keep in mind that the typical ratio is for research expenditure of 100, okay, you get less than 5% out in tech transfer and equity results. And many of these funds are late stage. Even university funds, they come a little later. Much of the early funding in Israel or in US happens through grant funding. That's the reality, right? Let's accept that also. And there is no two ways about it.
Just a point very quickly. The equity investment need not necessarily be in terms of financial or cash. The equity investment can be in terms of concession on the various services and other things, which Hyderabad University for their seed fund is to some extent following.
Yeah.
Just wanted to...
Sure. Thank you very much. With that, I'll hand it over to Apurva. Thank you to all the panelists.
There was a lot of knowledge exchange. I thank all our panel members for their invaluable insights and a wonderful session. May I now kindly request Dr. Shishendu Mukherjee, Grand Challenges India, Deputy Barrack India, to come on the stage and felicitate our panel members. be needing 1 more minute. Can we have a group photograph together of all our panel members? And yes, sir, please join us.
Yeah, please take on. Thank you. Thank you for the nice session. Great. Thank you, sir. Please, we have find somebody.
Namaskar and good afternoon. I am Dr. Nidhi, working as Associate Consultant at BioNEST. Shortly we will proceed for the lunch, but before that I have some quick announcements. Firstly, we have arranged a signature board near the entrance. So I request all to please sign your autograph and write your BioNEST name. And as we are already running late with the session, so our lunch time is for 40 minutes. So we will have our next session at 2:30. So we hope that you will make the best of this time to connect with each other. Thank you. We also have to gather for a group photo. So please come on the stage and arena yourself. Thank you.
Ladies and gentlemen, esteemed guests and honored participants, I am Rashmika Singh, Officer Technology Transfer and Commercialization. We are about to start our next panel discussion on the topic Scaling Bioincubation, the Way Forward. This session is set up to offer an opportunity to share and learn about the vibrant bioincubation ecosystem, its scale-up, evolvement and adaptation to the changing needs of startups, entrepreneurs and broader business landscape. We all must be eager to get engaged in a respectful exchange of ideas with our esteemed panelists. With this brief background, I would like to invite our panelists on stage. Our first panelist is Dr. Alka Sharma, Senior Advisor DBT and former MD BioRack. Ma'am, please join us. Dr. Alka has made significant contribution in research and policy in the emerging areas of biotechnology. She has been instrumental in promoting public-private partnership in biotech sector across the country. Her role as a coordinator of COVID-19 activities in DBT and BioRack has resulted in achieving significant milestones, including development of 5 indigenous COVID-19 vaccines. She is also coordinating the major activities of DBT. Some of them include biomanufacturing and biofoundries, and establishment of Biotechnology Research Innovation Council, that is BRIC. Our next panelist is Dr. Ajit Kamath, ex-head external R&D Pfizer. He has 30 years of preclinical drug discovery experience, primarily at Pfizer Worldwide R&D USA. Dr. Ajit joined Pfizer R&D Center in Groton, CT, Cambridge, and worked there for 13 plus years as an associate director. He has also worked in Pfizer as a senior director and head of external R&D innovation worldwide. His team contributed to 2 drugs, one in market and one is in clinical trials right now. Currently, Dr. Ajit is an advisor to 2 startup companies, that is Pandorum and Metastop Solutions. Our next panelist is Dr. Manish Diwan, Head Biofoundry, NCR Biotech Cluster and IFCOL, and Mission Director, Make in India for Biotech Sector. He has about 30 years of experience in biotech sector, from discovery, research to product development, science administration, project management, and leadership. He works as a sectoral lead for national missions, especially Startup India, Make in India, strategic collaborations including public-private partnerships, serves on national committees and advisory boards. For startup entrepreneurs, he has led national flagship schemes and programs of BioRack that include risk funding and setting up of incubation center for capacity building. Our next panelist is Dr. K.K. Narayan, founder, managing director, Thaika Seeds Private Limited. He is an academician turned entrepreneur who is trained as a plant breeder and molecular biologist. He has been a member of several committees and advisory bodies, including several task forces and working groups of the DBT. So please join us on stage. He is a member of the Vision Group on Biotechnology set up by the state government of Karnataka and is one of the past presidents of ABLE. He co-founded agri-based companies like Metahelix Life Sciences, Kotaram Agrofoods, and presently he is the founder director of another agri-tech company, Thaika Seeds Private Limited. Our next panelist member is Dr. Pushpa Vijaya Raghavan, director and practice lead, Healthcare and Innovation Advisory, Sadhguru Management Consultants. Ma'am, please join us. Sadhguru Management is a consultancy firm with market-leading presence at the intersection of strategy, innovation, and IP, transactions, and policy in life sciences. Dr. Pushpa leads Sadhguru's engagement with global biopharma industry and has shaped growth strategy for companies across specialty pharma and generics. She has stewarded IP licensing and tech transfer for institutions across global regions and has led more than 30 transactions across the spectrum of platform and product licensing. With this brief introduction, I would like to request our moderator, Dr. Pushpa, to kindly take over the session. Thank you.
Sure. Can you hear me now? Excellent. I think after that fig and honey ice cream, we're all energized to have a discussion about how to scale next. Clearly, we need energy, and there's no dearth of that.
As we're having this conversation, I think it is, I couldn't be more delighted about the composition of this panel because we have the architects of the ecosystem, we have stakeholders from industry and the ecosystem who have been friends of the journey, but critical friends of the journey. So, lays the ground for a conversation that celebrates success so far, but one that constructively looks ahead and ideates how do we take this to the next orbit of impact. And if we have to create the India that we're aspiring to create by 2047, what is the pathway for Indian life science transformational ventures, right, to enable that? So we have a prime platform. So I'm going to start off this discussion just acknowledging the success so far. There was one graph in the morning in the slides that Dr. Jitendra used, and it referred to 29 bioincubators in 2018, and today we're saying it's 95. So that graph is a very, very telling graph because this is, these are nests from where the ventures are flying out, and that's the scale to which we have primed the initial foundation to go to the next level of impact. Right? Today, which is why an initiative like the ACE Fund is opportune in timing because the pipeline is created. So the foundation that's laid is incredible. I'm going to turn to Dr. Alka Sharma to frame that for us, to walk us through what has been done so far to achieve the scale, the formidable, successful foundation we stand on today, frame that journey so far and the scale achieved.
Thank you, Dr. Pushpa. Good afternoon, everyone. It's my pleasure to be a part of this panel, and I must congratulate BioRec to organize this today, BioNEST and E-YUVA Conclave, with all the stakeholders in this room, and they are the driving force for this, and the way it was presented. Since morning, we are listening that what has happened so far in the last 5 years especially, and the role BioRec has played in facilitating, nurturing this vibrant biotech innovation ecosystem. I'll take you through this journey that kind of what moderator has asked, that what has been achieved so far, but I will be very brief about it because most of you are aware of the activities which are being facilitated by BioRec. But before that, as I said in the morning also, that there was hardly any ecosystem in the country for biotech sector. So BioRec was established by DBT in 2012. Before that, there were some small programs supported by DBT on specific domain-specific areas, as for example, biodesign and medical sector, and there were some more programs but there was no arm to promote, support, and nurture public-private partnership. So BioRec was established by DBT, and Dr. M.K. Bhan was the architect to establish BioRec. And now you can see after a decade that the kind of ecosystem through various schemes of BioRec through public-private partnership we have in the country, especially the number of BioNEST. And after 95, we have also seen that the group has joined morning that new BioNEST and also E-YUVA centers which we actually witnessed today morning. So this is something shows that growth of that organization along with all the stakeholders. So this the topic of this panel is bioincubation scaling up is very, very important, and also the very right time to discuss this because the way things are happening and the need has been felt by within the ecosystem, the gaps and challenges which have been discussed with various stakeholders including startups, industry, academia, and also SMEs. So how to address those gaps and challenges, maybe what kind of policy framework should be formulated by the government, because if you really see from government perspective, the role of the government is to facilitate and nurture that the ecosystem which has been created. From time to time, we have to also see and revisit our own policies and framework where are the gaps and challenges and how to address that to take our initiative to the next level. So very briefly, I just mentioned that very recently, just to take, because bioincubation and bioincubator centers, we are listening since morning, the achievements and all. I'm not going to repeat that, but the scaling up is the main thing, which is the theme of this panel. So the Department of Biotechnology has taken an initiative along with BioRec on fostering high-performance biomanufacturing. And this is something that we are at par with any international initiative, and in many ways we are ahead of them. And team has worked very hard to identify gaps and challenges in the existing ecosystem, including the bio incubators, and how to take those innovations and also from proof of concept, and what kind of requirements we have. That's advanced infrastructure, facilities, and also how to address regulatory reforms in each sector. So I'll come maybe later just to share that what has been the mandate and what are the objectives to take that forward, and how you as a stakeholders can work together with us to achieve our target, which has been set by the government. And that is all actually Genesis, if you really see, that was the National Biotechnology Development Strategy, where the target was to achieve $100 billion biomanufacturing hub by 2025. So we are almost there, and even we are hopeful that we will be achieving that target well before that we have set the target. Thank you.
Thank you for providing the big picture perspective. Dr. Devan, I'll turn to you. You've been a prime architect of the scale achieved so far in the bio-incubation ecosystem with BioNEST and related programs. So what's been achieved, the 95, are we celebrating that number? Are we celebrating the composition of what's in that 95? Where has that concerted effort gone? Give us a little bit more about the scale achieved so far beyond the numbers.
Thanks, Pushpa. I think a reflection is on this side. We are addressing the same forum, and you would realize, each one of you, that BioNEST Incubation Center Network is a network which has been kind of, if I may say, handpicked. Many of them, if you talk to them in side conversation, they will complain that committee had so much of inputs, revisions asked, and reverts, and it was a long drawn process of selection. So the reason is that the BioNEST family is a very strongly well-knit family, and each individual BioNEST incubator partner has a major role to play. Either it is working in a specific niche area, or it is representing a particular region where there is local geography challenge, local USP. So you will notice that within our biotech domain, it's such an interdisciplinary sector that it has to cater to a multidisciplinary clientele, which is your entrepreneurs and startups, and down the line becoming SMEs. So we have kind of accumulated pieces which can cater to all those segments. We introduced hospitals where we can seed incubation center. We wanted to attract clinicians right into not only just like mentors or advisors, but also becoming founders. So some of these incubation centers, at least 8 of them, they represent that community. We built in special capacity for toxicology and safety studies. So at least one institute, IITR, carries that specialty. We wanted large animal facility becomes accessible to all the community. So Tanuvas is one example. We found that Northeast doesn't have capacity, has not been touched and not have been included into the ecosystem. So we went down and then seeded 8 incubation centers in that region. I think you see the representation. And then they travel that far, like 2 flights, trains, the incubators, the incubatees, when we call in any central like conference, Global Bio India, for example, or Biotech Expo. So the pain and effort that they put, right? Likewise, we have many centers who specialize in medtech devices side, many centers who specialize in industrial biotech side. So each of these capacities have been built in, so it becomes a complementary ecosystem. And we have tried that. I think it's not numbers are not important. the capacity of this ecosystem to deliver and take India to the next level, that's what matters. Most of our startups are IP driven. And that is something which has been realized later in the day under the National Startup India Mission. Previously, emphasis was that we should have entrepreneur startups, and we got very large number, 125,000 startups, startups are registered. We realized that though we have these startups yielding products, but these are not top of the line, or India is not known, for example, that this particular product has been innovated in India and has been utilized all across the world. So deep tech startup ecosystem was emphasized, and I think BioRec was already doing it, the deep tech facilitation. So this network is very, very special, and there is also, if you look at around, people communicate to each other, connect, and that is backed by a very strong support from BioRec team, internal team, and the ecosystem that we have been able to build and partners that we have created. I think I'm flanked on either side, the mentors, experts whom we have kind of liberally reached out to facilitate us in this direction. I'll take a pause here and maybe come back to it.
Sure, thank you, Manish. No, and I think to what you just alluded, you have a floor of mentors, in fact, this side, and we've seen that energy and that spread.
And just a piece, let me put it this way, because these mentors and experts are our extended arms and kind of helping hands. And we have integrated in this journey of, let's say, 28 to now 95, we have integrated many representation from industry, investor community, industry associations, which was not there earlier. So I think that has really made us kind of relevant, and all departments, ministries consider BioRec as an idol, as a role model, and then try follow what are the best practices.
Sure. From here, I'm going to steer a little bit into looking ahead. I think we framed that we've got scale. We framed that we've got a qualified scale, which is built with concerted thinking on what that composition should be. But if we're going to the next level, one on incubation capacity, but also on what that incubation capacity achieves in terms of ventures it creates, it nurtures, and it advances into India and the world. I guess there are some building blocks that we could strengthen as we move forward. So we'll reflect on that, and then we'll come back into the upstream panel. So I'm also going to break that down into some of the enablers we need, but some of the sectoral thinking. So I'm also flanked by Dr. Narayanan, who is quite deeply engaged in the agri side, and Ajit more deeply engaged in the biopharma medtech world. So that's a nice breadth to draw on. Enablers, incubation managers. I know, Manish, you built programs on that, and we've discussed it. There is effort done, but we still need so many more high-quality incubation managers. It is a challenge, right? Yes, we have the ACE fund, we have avenues opening up for funding, but the value of death for ventures advancing, they get BioRec grants as a lifeline, they're born. They get next round of funding from BioRec, they advance their ideas forward, they get angel money, they get their initial wings, and then the wings could be clipped if you don't bridge the next gap. So there's the element of capital. There's the element of connectivity in industry. I think this morning, Dr. Jitendra mentioned that R&D is still concentrated in public funding in India. So until industry steps up, but then, Israeli ventures are a model, South Korean ventures are a model. We can reach out to the world. The world is our oyster, but we have to bridge that connectivity to industry some way or the other. So on those enablers, I'm going to turn to Ajit here to begin with. What do you see, Ajit, as, one of those key enablers that we need to further strengthen to go to the next level? I'm here talking about, yes, we've achieved the scale. We're going to pivot both incubation capacity and outcomes that ecosystem achieves, right, in the next 5 to 10 years.
Yeah, thank you, Pushpa. I think it has been an incredible journey for BioNEST, seeing 95, BioNEST centers all over India, covering various aspects. Okay, but one thing I want to address is going back to MD sir, industry connect. I think there is a huge gap as to how India operates versus how other developed countries operate. Okay. In particular, I want to give you a couple of examples that have been tested everywhere. There are so many companies working in the biotech sector, in particular biopharma sector, that I have the opportunity to visit them, meet them. Many of these are in the incubation centers. Many of them are on their own. Okay. There is a huge gap between what they're doing and what the biopharma companies want in India. Okay. So the place where I think there's immense opportunity, like MD had mentioned this morning, is the partnership. Okay. I'll give you a couple of examples. One is the Johnson & Johnson labs, are called as J Lab. Okay. I've known people who have worked there. Okay. It's a facility in the US. I think they have centers in San Francisco area, San Diego, Washington, D.C., and now I think they started in Shanghai. They're looking into Singapore and other places where there are no strings attached. It's a facility. Anybody can come. Of course, there may be some fees. I don't know the business model, but you can come. You can talk to the scientists. You can venture capitalists can come there, discuss with you, and see what type of you have all the facility, just like the BioNEST, and you can try something new out of the box. And that environment is really helping, because that's how you get the starting projects for bigger pharmaceutical companies or biotech companies. They just partner with them. We need a model like that in India. This is one example. The other one I want to highlight is Takeda pharmaceutical companies. They went through a lot of changes. Perhaps about 5 years ago, 6 years ago, they went through restructuring. A lot of people started their own company, taking compounds from the company and starting on their own. But recently they started something known as Innovation Park. Okay. Again, asking many of the startups to come and incubate in the Takeda pharmaceutical facility called Shannon I Park. Okay. And there you have access to all the scientists and all the regulators and everybody related to pharma development. Okay. So one aspect, I think, Pushpa, what we really need is a support from all the big players in India. I understand we are mostly into generics than innovative drug discovery, but still, I think it's a great opportunity for public-private partnership to have a center that can take care of many of these things. The startups can come there, and there are opportunities are immense. Though it is generics, let's just talk about bioformulation. Okay, there are opportunities in drug delivery. There are nanoformulations, and there's so many new things that the startups that I see can do in a facility like that, where there will be some guidance, some hand-holding by pharmaceutical companies, tailoring them to exactly what is required in the pharma, and that can go to the next stage right away, instead of these startups, these incubators are searching for potential partners. So one area certainly would be where, like MD sir mentioned in the morning, is to see how we can connect with public partnership, and have a center supported by, or rather visited by, various pharmaceutical companies, and they say, yeah, these are the projects that are of interest, but be aligned to what we need in 3 months, 6 months, giving a direction so that the companies become productive and take it forward. This is not only true in the biopharma industry or small molecules. This is true also in other areas, like looking at novel biomarkers. People are working on it, and this is only the beginning. Or if you are looking at, the companion diagnostics is another area. Microbiome. These are immensely target-rich, project-rich, rich projects that can be utilized for a partnership between a startup and a bigger player. So I think we have done a tremendous job. Again, thanks and congratulations to the entire team, BioRack team here, for going up to this number. But I think going forward, we have to look at how we can get private pharmaceutical companies, biotech companies to join hands with the government and then take things forward. That would be the leap I see.
work. Yeah, no, this is good. Thanks, Ajit. I think the nudge to not just, we create a platform for interaction. I think your nudge is saying, okay, yes, now we have platforms to interact, and we have a solid pipeline. So let's integrate industry more actively into this journey to be able to realize greater value from inventions. And they're going to advance it much faster. And to the point of J Labs, we were talking this morning that in Singapore, they just operated as a Asia hub, but no J Lab in Singapore. Last 30 years, there was a research investment from the government in the ecosystem. And now J Labs is saying, well, we're seeing the pipeline for us to start a J Lab in Singapore. And that's the catalytic effort India has done in a much shorter period of time. So I think, yes, we're very much there. On that note, I'll pivot to Dr. Narayan. Yes, please, Manish. Yeah.
Since you're mentioning J Labs and my friend Ajit is mentioning J Labs.
I know Stefan has been here.
There was a proposition from Johnson & Johnson to partner with BioNEST. And we went all the way to signing that MOU with J Labs. Then we realized what they said is that they would they came up with a proposition that India doesn't know how to invite challenge programs, and J Labs would be running a challenge by their proprietary name and inviting India's talent and making a selection. And then they didn't commit that they would be also offering Johnson & Johnson's industry expertise access to our innovators or our startups. And we went on to kind of ask that if this is the way, then there's no hard commitment, then we would not partner with them. And we refused to partner with them. And we told them, you offer the same thing that you are offering to other geographies. And similar case had happened with Merck. They also came up, but they refused to share and offer the same extent to Indian entrepreneurial ecosystem. And we said, no doing. You go back, you revise your policy, come back, let it simmer for some more time, because we were confident that our ecosystem is growing and reaching to a stage where the entire world is looking at India as a bio-innovation hub, so as to say.
I'm going to come back to that point on India's bio-innovation global hub, but before that, Dr. Narayan, I'll pivot to you. From your vantage point, what are key enablers that need to come together?
I can think of several key enablers, but before that, I think the last 10 years we have done significantly well in terms of building the ecosystem. It's been from 0 to 94 or 95 incubators. We are talking about 100,000 startups or somewhere around that number. So it's been all about numbers. It has been generally technology or sector agnostic kind of growth. So when you look at the next 10 years of growth or getting into the next phase of scale up, I think we should not just merely look at numbers, but we should look at the depth and the quality. You said, deep science. So those kind of startups. So when you talk of, so far I think if you look at the agri-food sector, you have had all kinds of enterprises from vermicomposting to vertical farming. So I think there has to be a focus when we go into, so when you talk about enablers, one idea is to build a kind of a focused approach which leverage on the countries and the region's strength. And that is going to be very important. For example, I can tell you that in terms of production and productivity, we are already there. I think we are producing enough for ourselves. We are one of the largest exporters of agricultural commodities in the world. But that's not bringing the beans as much as we would like to. And we should now focus on value addition, as they call secondary agriculture, because that is where the real value is. If you look at agriculture, if you are supporting agriculture ventures, you essentially look at ones which actually value add. In agriculture commodities, the value addition can range anywhere between 2 to 2,000% for some of the commodities. So that is the value which is being captured somewhere else I think we should get it back into the country and help the rural economy capture at least some part of that value in that chain. So that can be one. There can be other areas. For example, we can leverage some of the native crops in this country, grow them into big businesses. Now I'm talking about the millets as an example. But like some other countries have made chia and quinoa as big grains, there's a huge opportunity for doing some of those things. So one of the enablers is pick and choose the kind of venture that you want to support rather than trying to be general. So think about deep science, think about ventures. It may go down the tube. There may be higher risk associated with that, but once it can become potentially at least 1,000 crore kind of business. That's how I have some experience with some of the other incubators, and that's what we need to look at. The others can also be there, village industry, vermicomposting, those can be there. But if you have limited resources, you need to be picking and choosing some of the enterprises. The second enabler, if I can think of, and I will stop with this for now, I am picking up from the talk in the morning when the Director General of Drugs Controller General of India, he mentioned about regulation being restrictive and enabling or facilitating being on the other side of the line, even though the line he said was thin. Now trying to suggest that these are mutually exclusive. Strong regulation means it is not enabling. But I would like to present a different view. We need strong regulation to actually enable the growth into the next stage. I would like to use an analogy. A strong regulation is like a good brake system in an automobile. Don't worry. You don't use the brakes always to just keep the vehicle stationary. The brakes enable the vehicle to go faster and faster without getting into some accidents. So if you look at it that way, a strong regulatory system which is transparent, which is clear about which is predictable, is actually an enabler. And it is more important for the agri and the food sector. We have some legislations or acts which stand in the way, for example, Biodiversity Act. While it is useful to have such an act for prevention, sometimes the interpretations are all over the place. And that becomes a source of uncertainty in building up a business. There are these laws about gene editing, GM crops, and different people say different things, and you won't know what you have to do till you reach that the door of the regulatory agencies. So that is an uncertainty. People don't get funding because they perceive the risk to be very, very high, whereas the rewards can also be very high. So I will stop here for the time being and then continue with my thoughts as you come around the table.
Sure. Thank you, Dr. Narayanan. I think on the agri side, or rather overall, not just on the agri side, I'll actually generalize that to the whole pool. The quality of the pool, shaping that's going to be really, really important in the next phase. It's time to go beyond volume into really high quality ventures. On realizing value on that quality and creating India as a hub in the global context. Our ventures, we've got great initial success stories now of Indian ventures making their mark in the world, but we need to scale that up, right? We can scale that up 100-fold given the pipeline we have. So how do we go about that? How do we get Indian ventures to make their mark in the world, to be in markets in global context, to be acquisition targets for global enterprises, to be the ones that global venture capital funds are chasing? So how do we pivot outwards into the world? Yes, we solve our problem in an Atmanirbhar way. So if there's a problem in a low resource setting in handling neonatal monitoring, yes, we solve that with our own innovation. But how do we also put the next CAR T cell in the world? How do we create the next transformative agrobiological that addresses world food productivity issues? So how do we scale up Indian ventures pivoting to the global context? Open plane, yes, Manish, please.
See, I have two perspectives on this. One, when you want to go outside India, global, that ecosystem, if you compare, why would you like to go at the first place, right? You would see that that ecosystem has been built by people from outside their countries. lot of people, lot of talent from, let's say, US, Israel, you pick up any country. So people from outside US have gone there and created that ecosystem. That talent pool has been created. So one aspect I want to highlight here is India is largely, we are producing people, PhD scholars, postdoc, industry people. They go and serve outside India to the growth of that ecosystem. We don't get to see people working for us in the country for the growth of the country. So we need to see and analyze why that doesn't happen. Why can't we offer the same thing, and then rather than we going out, taking our leads outside, let those leads either come to India or let those leads get developed in India by people from India and the other brains from the best of the best brains from the world. That's one aspect, and I leave it for thinking how and why how we can do that. Second is which is more relevant to the current audience. I think we've been kind of recognized as a frugal innovator, very good adapters. We can live in minus 40 degrees as well as plus 50 degrees. In no time, we can speak any number of languages. यहाँ पे भी अच्छा करते हैं, बाहर भी अच्छा करते हैं. We gel well, so everything. So the pipeline of entrepreneurs that we have created, we get to see that they reach very, very quickly from ideation to POC, and within very limited capacities of incubation center, with very limited amount of funding, and they reach out very quickly, means in very, very short time. But what happens is they get stagnated at TRL 3, 4, 5, and they get stagnated, and they then compete with the established industries to source out or source in raw material or prototype production or pilot batches in the same CRO, same CDMOs, which charge as high as to any other client, like to the industry standard. And there we fizzle out. So all the innovation gets stagnant at this middle juncture of TRL 3 to TRL 4, 5. We need to address this situation. We need to build capacities for POC to pilot and pilot to early stage of manufacturing. This would be similar to, let's say, our incubation centers capacity. So another layer on top of it that can pick up the feed from the incubation network and provide that common access platform. Moment our leads are able to demonstrate pilot level activity or pre-product manufacturing level activity, their asset value increases, and that attracts all VCs, angels. There are scouts, people. All major innovator companies have scouts, designated scouts, who would just go and scan the ecosystem worldwide to skim the technologies, the leads, and then position it. And each company has a different kind of strategy, either to acquire it, co-develop it, or co-evolve, whatever. But these are different strategies. But these are scouting happens. So whatever we are doing here, there's somebody watching, either investor or the other industry player. So this gap, if we are able to address, our leads will be able to progress towards TRL 7, 8, and then automatically many people will be able to pull them up and give them a space outward and towards outside India. And there you will have all the power to negotiate out licensing, selective licensing, milestone payments, etc., etc. So I think these two things, common access facilities and attracting foreign talent to India, because they will then become our brand ambassadors and tell their peers that India mein kuch acha ho raha hai. This is the lead I think we should start talking to and explore.
Does anybody else have anything to add to that?
Yeah, Yeah, I want to bring up a couple of things, examples where I think there is significant activity that is going on in India, and that has, huge impact for countries. Of course, in India, in addition, others are also keenly looking at it. One is on biocatalysis. Okay, I think there are quite a number of companies, again, supported by Government of India and BioRac, DBT. They have developed methods for making enzymes that can do the reaction much faster than regular chemical synthesis. Okay. Some of these, in particular, help a lot bigger pharmaceutical companies. Though Indian pharma companies are not looking at them seriously, I know that companies in the US and Europe are very, very seriously looking at it and evaluating and saying, can we in-license your technology? Okay. So if through BioNEST activities, if some of these can be supported, I think that will be great. That's on the chemistry side. Because I'm from pharma, I'm talking about chemistry and biology towards drug discovery and related areas. The second would be looking at diagnostics. Okay. Again, there are a lot of companies in various BioNEST that are working on diagnostics. Using blood sample, just blood sample, and saying, these are the various markers that are there, and this can be used for diagnosing various cancers or other diseases. This again a very nice place where, again, thanks to all the incubators here, we have access to the hospital. Dr. Paul talked about it. Okay, that is certainly a missing piece in anywhere else that you go. So with the BioNEST in 7 or 8 different centers here in the hospitals, we have ready access to the samples, the technology, and then the doctors there to say, yeah, this is viable, this is doable, this has value. I think that is another area, Pushpa, where I think the value is tremendous because, again, thanks to the BioNEST way it has been set up.
So we're reflecting that in some areas we have a pipeline of relevance, and it's thus if we can also build a connectivity platform as a superstructure for international connectivity, there's better engagement, there's better understanding of markers of relevance, for instance, or what platforms required, and that pivoting to the international world will become more. So catalyzing that initial wave will then get that going in terms of wave of opportunity. Yes, Dr.
No, I just want to add, while it's useful to think about world as one and that as a big market, I think certain things we have to do internally to actually reach out to those particular economies which have the money power or the staying power to buy some of these deep tech kind of solutions, and that is in the area of IP. And though we have systems, I think there is need to strengthen them. So it's not enough if we just have systems, but they need to be seen as being implemented quickly and result-oriented kind of systems. Quick decisions are taken. So that's one area. But I also want to state that when we talk about the area of agriculture and foods, every 5th mouth in the world is actually in India. So, in fact, every year we increase in the number of we increase the number of consumers more than the populations of some of these states. So, if you want to build scale in some of those areas, I think we have
home ground is right.
Home ground itself, you can start and then spread towards outside.
No, I agree. But to play devil's advocate, Dr. Narayan, sometimes, just constructively reflect that domestic market which we have, which is a big strength, sometimes is a constraint because we don't have the same hunger. You look at in Israel, the hunger comes from not having a domestic market, right? So they can't survive unless they go out and realize value. And then they create a doxil in the world, or they created a kite farmer which goes into to Gilead and stories like that. So I think as long as we use it as an opportunity to create that initial momentum, but go out and realize value in the broader global canvas. I mean, in biostimulants, how many deals of that value threshold have you had in India as you've had in global context, right? So
companies develop technologies suited for India. For example, Netafim is an irrigation water management kind of company.
Yeah.
In fact, their major operation is in
and
India.
the chain solution. No, absolutely. Right. Yeah. No. I think as long as we leverage that and then, really use that and don't get complicit, I'm going to also take the nudge on, IP there, but move back into the pipeline. right? Because at the end of the day, I mean, if a venture has a solution, that's what, and there is a certain composition to our pipeline today, because ventures created in incubators, they created the big grant, it is born out of that ecosystem. In fact, we started the day talking about, and we had the national lab on the stage, we had university system on the stage. So how do we prime this significant public R&D investments and leverage that to strengthen our bioincubation funnel over the next decade? So how do we do better at getting public R&D to translate into ventures value proposition, spin out more institutionally created IP, and create a wave of transformational science that comes from publicly funded science, creating that funnel? How do we do that better? Dr. Alka, do you want to get us started?
Yeah, thanks. So we have many examples before us, and then in many cases it's a case-to-case basis, but IP is one of them, and it's a good example to just see the innovative research and then take that throughout that end-to-end. But before going forward, I would like to just share with all of you that scaling bioincubation that we are discussing, but the most important is the way forward. So we all are discussing here that whatever we have today and the expertise, experiences, resources, how to take them forward, and just in a meaningful way, where that moderator said that just for the commercial point of view, just bring the product to the market. So I will just tell you from government perspective that government is always ready to work with the stakeholders after receiving feedback from them. Where is the gap? How to fulfill that gap? And what are the possibilities through which they can be carried out further? So, for example, I mentioned about manufacturing and biofoundry. If you really see, this is the initiative which now is being discussed at various forums. So basically the mandate is just to have a system beyond bioincubation, have the facility with advanced and specialized facility, high-end infrastructure for the just to take the proof of concept further, whether with the IP or maybe in many cases that IP period is now over. So how to take that product, and bridging the gap is the right word basically. So under this initiative, you really see there are three baskets. So basically the first one is discovery and innovative network projects. So where innovative projects will be developed with all the maybe the startups and industry, academia. And the second is bridging the gap, which is most difficult part because many of the technologies are being developed at the lab scale. How to bring those technology at a platform where they can get the path to go forward. And for that, what are the requirements? That is very, very important to know because each technology has different kind of requirements. So what kind of a specialized structure that they need, and who all are going to do that, who are the mentors, how to deal with the issue like management of IP, legal, and also regulatory reforms. So the way actually the areas have been identified, there are bioenablers also, so to augment these areas, the thematic areas, and that also includes the example you have given, that CAR-T cell. So cell and gene therapy, mRNA therapeutics, monoclonal antibodies that fall under the category of precision biotherapeutics. So where actually this is case-to-case basis, the facilities have to be created, and it's not a small job because that the kind of first identify the problem and how to solve that problem, then you have to separate structure in place. So in terms of biofoundries that we are now thinking from government side, because that is where the government should come into the picture, because the kind of upscaling is required maybe that from 1 to 10, 10 to 100, 100 to 1,000, and after that actually once you develop some kind of pilot scale and pre-commercial scale manufacturing setup, then only you can just see that how to bring that in biomanufacturing hub. So basically if you really see from discovery and innovative network program, then bridging the gap, and then bioenablers like biomanufacturing. Before biomanufacturing hub is a biofoundry is very, very important, then biomanufacturing hub, and there is one of the most important key component, that is a bio-AI hub. So that is also a part of this. So basically in nutshell, that how to bridge the gap to bring that product in the market in a manner which is a requirement of our country, and how to take out those projects in the form of proof of concept from lab to the level of biofoundry, and from biofoundry after pre-commercial scale manufacturing to the biomanufacturing hub, and finally to the market. It's a long journey. The important point here is just to connect the dots. And it's not that simple, but it's doable because with all stakeholders, the way the discussion has been carried out and the gaps and challenges have been identified. The only thing is that how to put the thing and system in place to address those challenges. And also the outcome is very clear that we should have some kind of structure in place to produce bio-based products, and that is the global challenge also. So we are working at national and international both levels.
Excellent. So you think with that initiative of DBT and the biomanufacturing framework, BioFoundry, we should be able to bridge some of this gap and in the emerging opportunity areas.
Yes.
Excellent. You have something to add, Manish, in terms of enhancing the pipeline from institutionally funded research?
Yeah, I think just to give a example to kind of provide a perspective. See, the ideal scenarios looking at the global biotech clusters. So there are different elements which coexist very close to each other, so to allow cross-fertilization. There are R&D institutions doing top-of-the-line research. So there is a training of manpower within that scenario. The industry R&D systems co-locate, so they can connect and see what is brewing in the academic institution and also influence that these are the future trends. Why don't you pick up this kind of problem statement? Then there are policies and incentives, which actually is the task of the enabler, the government or the state government, local area, to provide that environment, policies, some incentives that you can walk in, use warm shells, like I think Dr. Priya is here, Tycel, Titco, right? So you create that real estate kind of model, Singapore's Biopolis. So you come with your raw material, manpower, and start work equipment and start working in that premise. So we need to create, once we have that kind of an ecosystem, then people who are looking for technologies, investments, regulators, facilitators, they also come to converge. Suppliers, vendors, they would also try to co-locate and visit you more often. Aapka kya order hai, to assimilate that market mind. So we need to create such environment. And if I may say so, the NCR region in close by, that offers such a platform. And we would, DBT has tasked that why don't we pick up that as an example to create a planned biotech cluster. We'll start calling it as Biosciences Innovation Park. So to bring all such elements. Likewise, if you build such clusters across the country, I think that will really spun things out, what we are envisaging, and we will create a bandwidth which is globally competitive. People would be looking at it not only from the PI's perspective, but industry, so-called academia, industry interaction. And we are blessed with such a vibrant startup ecosystem. I'm sure like moment you put it out, there would be so many takers and visitors here. I have one or two things, because this is probably the audience which has a direct impact on what we are seeing as a future outcome of our startup ecosystem. If I may, get a couple of minutes?
Yeah.
Yes, sir. Sorry to digress a little bit and downscale what we are looking at in future. It's very important what we are doing today. And I see each one of you catering to around 50 startups in your, let's say, in a year or two, each one of the centers. So imagine 100 centers, 50 each, 5,000 startups, and a scale of, let's say, 5-10 years. You have a multiple of that, right? So that's the power that you have, and you are the enablers. I have a couple of observations, candid observations. Kindly don't take it personally, but these are based on factual facts. Many of us who are sitting here are younger incubation centers, and they still have to attain a status of mature incubation center. So I urge you kindly connect with those who have already done 10, 15, 20 years in this game, learn from their best practices, absorb as quickly as possible so you shorten your learning curve. You need to reach there in less than 3 years, 5 years, what they have taken to attain in 15, 20 years. I think that's the advantage of BioNEST family. Second piece, I would suggest that please aim to build your incubation center that can serve 50 startups at any given point. So today might have started with 10,000, which is the minimum requirement, but kindly keep a scope that you can expand and build your incubation center of that size and capacity that you can cater to at least 50 incubatees at any given point. Incubatees means startups, not the individual members, right? So that will increase your probability of success as well as the 50 people thinking innovation. There will be many more innovations churning out, and it will just create that local ecosystem. To become meaningful and relevant to entrepreneurs and startups who have highest expectations from the CEO of or the team of the incubation center, because they are naive and they are just trained in sciences, PhD engineers. They would just walk up to you for all mentorship, hand-holding and direction. You are the lighthouse. Often we get to see that incubation centers, when they present in the committees, their financials are as simple as this much earning, this much expenditure. They would add it up together to reflect as EBITDA. So I think this is real, and we have seen it in many cases. So that is the bare minimum subtraction and bare minimum projection. So a point I'm trying to highlight is the financial awareness, understanding is not there. So that capacity we need to build up, because you are the guys who are telling them how to set up a company, what should be your share structures, आप कैसा equity दें किसी को, कोई आपसे if you are raising investment. So I think these basics, some of these minimum things, kindly spend more time and attain that skill set. Very, very critical, and it would start reflecting in what kind of clientele you serve, because incubation center is a service model. So the pipeline that you would have, the pipeline that you would be eventually proud of because they are successful, that is directly influenced by what kind of services you offer to them. So more you invest now, I think you would be the proud success owner down the line, and of course the fundamental contributor of the ecosystem. I took longer. Sorry about that.
No, thank you, Manish. And I'm going to come around for a round of quick concluding remarks. But before that, when you were doing that math on the numbers, that 100 incubators, if you have 55,000, I'll even get a little conservative on that. 100 incubators, even let's say 30 on an average. You're looking at 3,000 venture pool. Yeah, no, I agree. On the venture pool, absolutely. I'm just taking that to funding need. So even if 1/3, okay, there are grants for the base, let's say 1/3 go to certain stage of equity capital, on a very conservative basis, say even 10 million per venture for 1/3. You're looking at 1,000 ventures requiring 10 million, that's $10 billion of equity required. So the capital access void that's there in life science is not a problem in tech today. If I'm an e-commerce venture, money is at my doorstep. Right? But life sciences, we're staring at it, ventures struggle to raise money, in a very bad way because the pipeline is getting richer, but the money is not catching up, right? It's very slow to catch up. So we will need to declog that. So quick comment on, this access gap on capital for scaling up.
Let me take a dig on this. We have seen very positive movement in this direction. And I think more people say that there is enough funds available. It's just that they're looking at the right proposition. Since we also support fund of funds, we see that the LPs in the daughter funds they are investing from outside India, and there are more of it. The fund sizes have, over a period of years, have increased. Previously, you used to get 250 crores, 500 crores, 600. That's about it. Now we are seeing 1,000 crore plus funds and kind of focus on biotech areas. So there is forward movement, and moment you seed in 50 ventures in one incubation center, I think like it will self-attract, self-nucleate a lot of funds and let that flow in. I'm very optimistic with regards to that.
I share your optimism, but we just need to go and translate that to a larger pool of
government policies like Gift City is an example, right? Out-of-box thinking. There was an announcement, 1 lakh crore funds dedicated for deep tech startups. So we are pushing that for fund of funds we can come back with next round. So with 150 crore corpus, we've been able to facilitate 1,100 crore direct investment in the biotech startups. We were expecting just about 300 crores. So see the multiples. And down the line, those people who were invested, 88 companies, they had raised close to 4,700 crores. So I think that is the power of science and science-led enterprises.
No, that's catalytic, absolutely. I think what we need is more of that catalyzing. Before I go on for that last 1 minute closing remarks, any burning questions that will not let you sleep tonight? If it's really burning, please. I see Dr. Premnath smiling. Is that a question or a comment, a controversial comment? Yes.
State startup cells. I think just to answer your question, the access to funding, seed funding is also there with every state startup cell, because every state has a startup cell, and on an average, every state is funding almost 50 to 60 startups a year. So I think startups have a potential to tap the funds from there as well. Apart from Startup India Seed Fund, the state budget also has funds.
That's adding to the pipeline, absolutely. I'm just concerned the next round's a challenge, but no, absolutely, point taken. Yeah.
Any other questions?
I just wanted to add, the point Pushpa made about the funding is a genuine one. We need to think about it, because if you roll it down further down, you can also estimate how much grant money is needed to fund all those startups, because you need a pool. And without the pool, you're not going to get there either. So we do need a scale up in the SBIR phase 1 equivalent in India. If we don't have the pool, we won't have the numbers either. And it is a funnel at the end of the day. Yeah. So you will not have enough candidates available. Yeah, so I think it's a good point to keep in mind for scaling bioincubation, because I think there is no other way. I mean, we cannot think that we are going to behave differently than the rest of the world, just that everything will happen through investments. I don't think that's likely.
No, absolutely. A final 1 minute to every panelist for a concluding statement. I am getting a smile, which is like a request to closure, I'm sure, but we do need a 1 minute closing statement from each of you. I'll have Dr. Alka.
Yeah, so a lot has been discussed now. So last one word actually is not, but we all have to work like a team, and then the way we are discussing funding, I will just mention here. I would like to, because other things, it's a detailed discussion required on those things, but at the same time, when we are attracting investments in these kind of things, that is very, very important in public-private partnership, in biofoundry or maybe biomanufacturing hub or biomanufacturing activities. But creating a mechanism to absorb that fund and channelize those funds in a proper manner is also our duty to see. End to end, and it's not easy that way, but it's maybe having some kind of mechanism in place that can be done. For that, we have to ready, and then only that we can see some maybe as an outcome of the fruit of these activities and exercises. But the sky is the limit. We can just try and then do. Thank you.
Yeah, Pushpa, as we are looking into scaling up of the bioincubators, and all of you are managing various bioincubators, my request is identifying a very nice mentor for each of those incubators who are there. I think it's absolutely critical. I've seen lots of youngsters coming with a lot of enthusiasm, and they essentially get lost. Once they reach incubators, they don't know how to go forward. So, take them under your wings, provide them as much support as possible, connect them with people. If not, reach out to other BioNEST who will be able to do it, so that the people who are coming there with all their heart put together, they will be able to reach the goal, particularly in developing new products and bringing products to the market in an affordable way. Just wanted to bring that up.
जैसे फिजी और ये नारायणा वाले करते हैं, तो what they do is they create a cream batch separately and handhold them differently, and सबका बाकी का सबका चलता रहता है tutoring, but that cream batch gets extra attention, extra effort. So my humble request to all of you is identify 10 startups in your respective incubation center. Set a target that in next 5 years where you can help them reach to and what stage, and kind of push and provide all the kind of energies that you have, your network, your strength, and build that up. Together, I think if we do that as a whole, as a community as a whole, so we're looking at 1,000 startups reaching to a milestone in next 5 years for certain. So that would be my request.
Thank you. Couple of things.
You have 1 minute though.
Okay, that's 10 minutes, 10 seconds for each, so I can take 6 things. I think there needs to be a change in the mindset, and you as incubators need to really work on changing the attitude. I think India today is not the same as what it was in the 70s. At that time, we used to romanticize the image of a Punjab farmer fitting a water pump to a bullock cart and then using it as a people mover. So that kind of jugaad mentality should change. And if we have to reach global markets, you need to harp on quality and the functionality, and those are very, very important, even the appearance-wise. So that is one. So get out of the jugaad mentality, try to build products which will suit the world. The second thing is you don't have to always justify your project or proposal by saying that India is a poor country, farmers are all starving, and we need to really provide something very, very cheap. In fact, from the perspective of cheapness or pricing, I think your attitude should be towards creating value. These are two different, affordability and value, these are two different things. How much, for example, a person who looks for an iPhone is not going to be sensitized by the price. It's not price elastic, such a product. It's a disposable income. So in such instances, you can price it like the competition from outside, so that you will have the reserve money to continue to do the stewardship for the product, continue to improve, continue to innovate. Otherwise, if you try to sell it cheap, I think what you will have, you will end up with no management of the product in the market, the quality will deteriorate. So these are two good points. May sound a little controversial, but I thought I should make this point in this juncture. Thank you.
Yeah, absolutely. Thank you so much. I'm not going to add much. I'm just going to say amen. We're going to see 1,000 successful milestones. Let's ascribe a threshold to that, like revenue, fundraise, global success, and make those happen. There's emerging areas of opportunity in biotechnology, and we've got an enabling ecosystem. Let's pivot India into the world on that. So thank you so much. It's a great conversation.
On everyone's behalf, I would like to thank our panelists for their insightful contribution to the discussion. Various perspectives and ideas have been explored, and I believe we all have gained valuable insights. As a token of appreciation, I would like to request Dr. Jitendra Kumar, MD BioRack. Sir, please join us on stage to present our panelists with a small memento to commemorate our discussion today. Dr. Alka Sharma. To Dr. Ajit sir. To Dr. Manish Devan. Okay. To Dr. Narayanan. To Dr. Pushpa. To capture this moment, I request everyone present on stage to please assemble for a group photograph. We'll take a short tea break and we'll again meet in 10 minutes at 4 p.m. Thank you, everyone.
So this session is BioNEST cluster augmenting in incubation through cluster initiatives. So few years back, during our second BioNEST conclave, we created regional clusters based on geographical proximity. So I would like to first invite Dr. K. Suresh Kumar, Executive Director, PhD STEP from Tamil Nadu cluster, BioNEST Tamil Nadu cluster, to come on the stage and give his presentation. Dr. Suresh. With them, okay. So till the time he comes, let's hear from our next BioNEST cluster from East and Northeast region. I invite Dr. Swapnil Sinha, CEO, BioNEST IIT Guwahati, and Dr. Namrata Mishra, CEO, BCKIC and advisor, KIIT TBI, to come on the stage and start their presentation. Thank you. So ma'am, your presentation is in PDF format, so it's already here. So what will I do? I'll just click for video. Change it? No, it's not here. It's control. It's displaying. But is it being displayed? Yeah. So I'll just put how to? Just a minute. It's already. So how to change it? You just have to click next. No, it's not changing. From here also you can do it. Control L. But it's a PDF. Okay. Yeah, it's fine. It's working. Yeah.
After break sessions are very difficult, I understand. Namaskar, ladies and gentlemen, and all the members of the BIRAC community. We say a family, a community that stands so strong with footprints across the nation. Now, BioNEST, as the name suggests, is indeed a nest for Indian startups to flourish. And it feels proud to be a responsible member of such a wonderful, close-knit family and community. Now, the theme of this session is very important because when we talk about New India 2047 or Make in India Atmanirbhar Bharat, it cannot be the effort of a single institution or a single individual or a single incubation center. Definitely, it demands collective action involving various stakeholders, be it academia, be it industries, startups, incubators, state, central government, all working hand in hand in a cluster approach. And BIRAC East and Northeast and the cluster initiative is a testament for this vision. So me and Swapnil have been given 10 minutes time. Again, in the cluster approach, we have to present about the East and Northeast clusters. Sorry? Okay. About the East and Northeast clusters. So I'll quickly give a glimpse about the origin and the journey so far and then hand it over to Swapnil. She will take us through some of the significant milestones achieved over the years. So it was on 20 May 2021 during the auspicious Azadi Ke Amrit Mahotsav that BIRAC launched the East and Northeast cluster with the vision of reaching the unreached or leaving no one behind and progressing the SDG from global to national to local. It started with a small nucleus of 9 incubation centers, 7 from Northeast, 2 from East. But as the journey progressed, more incubation centers, more members joined in this revolution to make it a big community. And today we can proudly say that East and Northeast cluster has slowly but strongly carved in the niche in the startup ecosystem pan-India. And we will all agree, since morning we have been talking about that geographic is no more constraint. So there are no more the buzzwords like startups are only found in bigger cities, like East and Northeast are Startups are really creating a buzz, and there's East and Northeast cluster is positioning itself as a conducive ecosystem for startups to flourish. Now, as history tells us, for any revolution to happen, a small ignition is needed, and BIRAC BRTC Center, established in 2019, was that small ignition to create the momentum, to bring all stakeholders together under one umbrella, to create a vibrant East and Northeast cluster, which is now translating into tangible outcomes, be it in terms of IP, be it in terms of starter supported, and be it in terms of funds mobilized, capacity building programs conducted for starters, for incubation numbers. I'll not go into detail about the impact because the numbers are quite visible in the presentation. It speaks about the intention. Earlier there were very few startups in the portfolio of any ministry, be it BIRAC, but now it's like more than 100 startups are now connected in the system. A valuable compendium of 110 technologies which are at different TRL level have been sourced and mapped. So much of funding have been mobilized. It's not only the BIRAC BIG grant or this FIRST program, but DST, METI, Startup India Seed Fund, all have been given to all these Northeast startups. So, but I believe that these are the tangibles, but equally important are the intangibles that has been created with the BIRAC BRTC impact, be it in terms of the understanding the ecosystem better, understanding the local resources, so much of strength available in the Northeast. When we went there, we understood that how much of potential is there in the region, that kind of mindset, the kind of community that has been built over the years. I think that impact is overwhelming, it's outstanding, it's not comparable. Now, one of the significant milestones achieved is the Manipur Technology Innovation Hub. A 6-member team has been deployed there. While 2 years or 3 years may be too short to draw any inference, however, our understanding in the system, we got to know about what are the developmental challenges the state possesses, and help us to chart a way forward about how to bring inclusivity in our initiatives. So, besides a lot of capacity programs that BIRAC BRTC has done, more than 75 capacity building programs, including startups, including incubation managers, but we also have conducted a lot of showcase event, like the Northeast Startup Showcase event, where startups not only from the various states of the Northeast, but outside Northeast also came, joined, and had a crosstalk and collaboration. I'll just take 1 minute, Swapnil. So one of the significant outcome or the achievement, I would say, is the BIRAC Big Northeast special call that was initiated. And for the first call, the response was so much of overwhelming, 110 applications received. Just imagine, only from the Northeast state, 10 got supported. And then BIRAC rolled out the second call. Again, more than that, 180 applications received. 25 got funding of 50 lakhs each. So there's so much of strength. We always talk about the challenges of Northeast, but actually that's not the case. There's so much of potential, the ideas. We really had a tough time. The selection committee had a really tough time in selecting the top 25 because the ideas were so great. Again, 4 technologies have been transferred. 2 from Northeast, from Tripura University. We realize that technology transfer is a difficult ball game, but 2 technologies from Northeast, wonderful. 2 technologies from East, from Odisha, and 4 of them, again, BIRAC supported through BIG grant. That's a wonderful milestones achieved. Furthermore, impact extends to rural women entrepreneurs and SHG groups, where we impart them training how to imbibe their traditional knowledge with modern biotechnology techniques. A lot of, and I would say anybody who has been to Northeast, you will know that IMA market. So definitely we can proudly say that women in Northeast are very, very enterprising, and BIRAC have really strengthened that ecosystem, have brought everybody together. These are a couple of clusters that has been developed, initiated with the BIRAC support, and again, MSME Spurti scheme joined it, brought together 500 local women entrepreneurs and made them into cashew nut cluster, lemon clusters, and so on. So I'll stop here. I'll hand over to my colleague Swapnil from IIT Guwahati. But again, I'll take this privilege from all the cluster members. I see a couple of them sitting in the back. Thank you to BIRAC for all the support. I think this initiative of East and Northeast cluster should not stop here. We come with a lot of hope, and the hope that has been generated should not be diminished, should be strengthened more. And thank you, BIRAC, for all the support and all the cluster members for their contribution. Without coming together, mission cannot be accomplished. Thank you so much for listening. Swapnil, over to you.
So thanks, Dr. Namrata. And this is true because when IIT Guwahati BioNEST came into existence in 2021, we had a set stage which was actually created by KIT TBI because they had presence in northeastern startup ecosystem since long. And so when we joined in as the newest member of the Northeast BioNEST cluster in 2021, we already had a template. And we took their legacy forward now, and now IIT Guwahati is actually leading the entire Northeast ecosystem. And that could have never been happened if all the BioNEST, and so Northeast has got 28 incubation centers altogether in eight states, and 7 BioNEST. So when I joined, we identified certain gaps in Northeast, and I don't belong to Northeast, I belong to North India, and I have seen startup ecosystem in Bangalore, in Hyderabad. So here it was very different. It was very challenging, and it took us a while to understand the gaps. There are certain gaps which we identified. The major ones was that it was really accessibility to infrastructure was the main gap. The startups here, they don't have much accessibility to cutting-edge technologies, equipment, or any kind of a connect outside Northeast. And also, the hand-holding was lacking in terms of product development, in terms of taking the product to the market, regulatory compliances, they were not aware of what needs to be done. And then there was no investor connect. When we did our marquee event Kickstart, so we did do it every year, the first version was a disaster to me because we didn't have many investors coming in. They have never witnessed any ecosystem in the Northeast. They haven't traveled to Northeast. So it took us a while, full 1 year, to show them the ecosystem. And then this year when we didn't even call anyone, they wanted to come. So that was the entire template that we have set across 3 years. And then then there was a problem with the founders. They have a little understanding of the market. They have a very limited understanding of what they are doing in the Northeast. They want to sell their products in the Northeast and just they say that, okay, fine, we are doing great. So we wanted to, make them dream big. So, and then we thought that, since we know that there are 28 incubators across Northeast, we wanted to first start with all the BioNEST because, like what, we were listening since morning that it should be a collective effort rather than a competition. So, when IIT Guwahati, we just combined all the BioNEST, we formed a cluster, we formed WhatsApp groups, we formed mailer groups, and we did a lot of joint operations. And what we did is we exchanged ideas. We kept on, so all the BioNEST, say Nehu or NEEST and NIPER Guwahati, we told them what IIT Guwahati can provide them. And as a technology institution, which is, a technology institution like IIT, lots can be leveraged by the startups. So in collective, all the BioNEST of Northeast, there are around 190 startups that are incubated across at present. 31 of them are PIT grantees, and almost 100 of them are DPIT registered now. When in the beginning, I remember that when startups used to join our incubation, they didn't even know what DPIT is. We used to tell them how to register on Startup India portal and get registered. So, but that is changing now. Now whenever they join us, they say that, we know and we have a DPIT registration. So this is what, being from IIT we can provide. And that's what we are doing regularly, like every week, every month we do. We provide mentoring. And this mentoring is very different because Northeast is a very challenging template to work. You have to understand the founder psychology there. You need to understand what they want and what they want for their product. Sometimes they understand their product well, and there are a lot of resources in Northeast. Northeast is biologically, it's very diverse and very rich. And a lot of products in Northeast, they are agri-based from the ecosystem. So we did, and so I remember there is one startup in Arunachal, and he doesn't know, he makes wine out of kiwis. And he doesn't know, he was just selling that wine in his state because he doesn't know how to do FSI clearance and everything, doesn't have no idea, and he was totally clueless. So this is where we came in, and this is the mentoring that we provide them from scratch. What are the regulatory compliances that you have to do as an agri startup, as a healthcare startup, device startup, any of that kind. So this is the impact. So we began accumulating or forming a cluster with the BioNEST. Then I said we had a lot of other incubators there. And so we thought that these incubators, and most of the incubators in Northeast, they are state-owned, like Guwahati Biotech Park, Assam startup. Then we have this YouthNet, again Prime Meghalaya. So these startups, and they keep on coming to us, and they wanted to have, they say, okay, fine, let's work on a co-incubation model. We said, no, we don't want co-incubation. You let these startups interact with us. Whatever kind of help they want, through them, we incubate them in our, not incubate actually, we just accelerate them in our programs. We help them whenever they need in terms of, especially the help they need is in the market connect, in connecting to the investor, even writing a grant. So this is how we are connecting, and these all ecosystem partners, they have their own startups, and they are of not only just healthcare or in biotech sector, we're in different other sectors also. And we are just, trying to build them together, their product. And so recently what we did, so there is one spin-off of Donor, Ministry of Donor. This is called Northeastern Council, and which actually is working since 1970s for the entire Northeastern area. And we went to them and we said, see, we want to have this startup ecosystem developed in entire Northeast. So that is when we launched this program called NEC Ignite. So we have around 5 crore corpus only for the startup grants, but these startups should be registered within Northeast. The ROC should be in Northeast. There was another problem in Northeast, and this we understood when we started this program. So the startups in Sikkim, they cannot register themselves in very seamless manner because when Sikkim came into mainland India, still there are certain rules and regulations. Company laws were not very much defined. So they generally register their company either in West Bengal or they just take some trade license and start their businesses. So we help them build their company. We help them in incorporating their company in Shillong ROC, and then we leverage them. They can use this grant. So in the first cohort, we launched around 22 startups, and these all startups, being from IT, we have this, I wouldn't say constraint, but we wanted to limit to only to the deep tech startups, and then help them build their product to the generation next level. So we have around 22 startups that we have launched in the first cohort. So like I said, being in IT, it gives you one very good cutting-edge technology platform. And so we have, from IT Guwahati, we have all the instrumentation facility, which any startup can use, and we don't charge as of now. They can use the facility that we have in BioNEST. They have this facility in Central Instrumentation Center of IT Guwahati, Center for Nanotechnology. Plus, they want some kind of intellectual help from any of the faculty. We make them happen for us. It's very easy to do. And then we do lots and lots of training programs for these startups so that they can build their skill. And also for the faculty, we have started a new program in which we are we are building capacity for the resource building for the faculty from colleges and universities. So we are currently having 4 kinds of different funding schemes for the Northeastern startups. NEC, I already explained, we have Startup India Seed Fund. Again, Caspian Equity came forward with us, and they wanted to have a corpus only associated with the Northeast startups, and that too in agri sector. So that is their program called LEAF, and we are the main partners because the corpus is coming from them, and then we are trying to recruit the startups, scout the startups, and then we start funding them. So this program we started, and in the morning, Dr. Jiten was talking about the translation from academia to industry and why this is very difficult to do. And being in an academic institution, being in academia for almost 5-6 years, I realized that say IIT Guwahati, it has around 200 patents lying there, which have a huge commercial potential, but they never see the market. So we recently launched this pilot program in which Saatchi Connect and IKP Prime is kind of a partner, ecosystem partners for us. And what we are doing in this, we are recruiting technologies from the academia. As of now, we are recruiting from IIT Guwahati and ITs from Northeast. And then we are helping them to translate it, and we give a choice that you can, the PhD fellow or a student can make their own venture, or we transfer that to a company or a startup. So recently we have 2 success stories. One patent from Center for Nanotechnology we have recently transferred to this startup called Hamsa Biotech. And they are now doing the clinical trial, and they'll be taking up for, they actually already have raised 1.5 CR from equity investment, and now they are taking up to for the commercialization. Again, there are 2 such patents. One is commercialization of smart IV, and there is a thermal jacket for mountaineers. These patents are with IIT Guwahati since long, and we recently transferred them. So one of them, we helped the student to actually build a venture, and we funded him both of these startups with some kind of Kickstarter grant, and then they are taking up, building the product for the building the commercial product. So a little bit of success stories. So in NEC Ignite, like I said, we had 22 startups, which are totally tech-based startups mostly in agri sector, that we recently launched. And then again, so we have this marquee event, Kickstart, every year. And so Kickstart 2, last year it happened, and we got around, so that was the event when we actually invited investors, and we wanted to tell them, you just come here, see the ecosystem, and make your opinions, because they were very reluctant to come. So we invited around 30 investors in the last Kickstart 2, but this year we didn't invite anyone, and they just called us that we want to come. So we had around 20 investors in this event this year, and we have got around 17 startups who got soft commitments, and 10 of them are from Northeast. Among those 10, 5 of them are from the different BioNEST. Like one of this 7 United, he's from, this startup is from Nehutura campus. I think Dr. Nandi is here, yeah, so it is his startup, yes. And they recently got intent from Inflection Point Ventures. He's also funded by our NEC program. It's a very good product. Again, Fuloni, this startup is again incubated in 2-3 other BioNEST. Recently we helped them raise funds. And Symbika is again another startup which is also incubated with KIT TBI, and he's doing pretty well. And again, he has raised recently investments. So that is all. This is what all the BioNEST here, and 2 of them are here actually. This is our motto, make in Northeast, build for the world. Thank you.
Thank you, Dr. Namrata and Dr. Swapnil, for highlighting all the activities and development that is happening in this region. I call all the representatives of this biocluster to come on the stage for a group photo.
Dr. Nandi is here, and
Mizoram, yeah. Yeah. So now I call upon the representative from BioNEST Tamil Nadu cluster, Dr. K. Suresh Kumar, Executive Director, PSG STEP, to come upon the stage and deliver the presentation.
Good evening, and a few disclaimers before I finish up my presentation next 5 to 10 minutes. Northeast is one end and South is the other end, and Coimbatore, we are representing the down south of country. Northeast mostly covered about their startups and their contribution to the startups in strengthening the bioeconomy. Whereas in my presentation, mostly I'm going to cover how the incubation centers have benefited out of this cluster. Right, in turn, the startups would have gone. The third disclaimer is, I think I am odd man out. While this cluster has been formed, I have been asked to be part of the Karnataka cluster. I put a long request, detailed request to Manish and Chaya, right? I don't want to be in RCB or in Sunrisers Hyderabad. I want to be in CSK. Because at least in CSK, we don't have a player from Tamil Nadu, so I have to be there. Right, this is the third one. And rest of the things, right, I will cover during my presentation. So as a cluster, we have been identified with 10 incubation centers. And luckily, all the clusters has a big brother, either IIT or some NITs or some research labs. And we also have a big brother with us from IIT, HTIC, who drives this always, right from the day one. And we have Shastra, Crescent, PSG, and about 10 incubation centers. I'll come there, why I put a process. Out of 10, this is the breakup, right? Out of 10, 6 is from Chennai, 3 is from rest of Chennai, and 1 is from rest of Tamil Nadu. Now the situation is, today morning after seeing the announcement, it has become like rest of Chennai is now 7. Sorry, Chennai is 7 and rest of Chennai is going to be 3, and we are going to become 11. And I have put a request that it is right time for BioRac to have a regional office in Chennai, I think so, for the south. Right, this is a request to you because we have more, it's not only for Chennai, I'm talking for on behalf of south. Right, so this is the distribution of our cluster members. And the impact that we have made in last 4 years, right? All these cluster members have put together, have supported about 483 incubatees, out of which 127 are women-led. Faculty-led is about 56. Job offerings is about 1,300 patent filed and patent granted, funds raised. And I've seen a considerable increase because same last year by this time, the same month, May month, on May 8th, we had a meeting at Tanjavur at Shastra. A presentation has been made, and we found that there is a considerable increase of about 20% in whatever we have done. So there is an increase in the numbers that we have done when we compare to the last year's number. What are the initiatives that we have taken? We have conducted cluster conclaves, product launch, product showcase, pitch workshops, investor connect, market connect, thematic workshops, incubator visits, farmers network, clinicians connect. All these initiatives, certain initiatives we have taken from the other incubation centers or other clusters or other incubation centers based on the information. But what is the lessons that we have learned out of this 10 incubation centers together? Happy to say that all the 10 incubation centers have contributed to the clusters. Right? We can't leave anyone. All of them have contributed. It is almost 4 years, I think so. Out of 48 months, 42 monthly meetings have happened. Right? So it is about second Thursday or fourth Thursday, I think so, third Thursday, right? If a Thursday comes in, then we have a problem. Right? Because each one of us has to say what is that we have done in last 1 month. Unless whether we are not performing, at least we have to say that I have gone to Chennai, I have visited HTIC, had a coffee with him, right? Or otherwise, right, I will not be missed out. So if at all I have to say that, I have to give a leave of absence. What will happen is if I'm not giving a leave of absence, then I'll get a phone call from Sumitra saying that, Suresh, nobody has joined from your incubation center, we are waiting. So how many months you can give a leave of absence? So one thing what has happened is, right, it has become like a self-discipline for us. We started performing, it's a peer group pressure or peer group learning. It is like a follow-up, right? And automatically we have a discipline of giving leave of absence. And if at all we are giving leave of absence, next month we ensure that we'll be participating in that. So one lesson what we have learned is this cluster initiatives, the contribution by the members have made us to work, made us to think, made us to contribute. I can't say the same initiative for 6 months. Right? At least some initiatives have to roll out. And after 6 months, the another lessons what we have learned is, some incubation will say that we'll do a product launch, we'll do this, that, and I can't keep quiet. I have to come and volunteer that, okay, within next 3 months, I'll contribute this for the cluster, right? So this has happened, and out of this 4 years, 3 cluster convergence has happened, means that we have met thrice, once in a year, 2 times in Chennai at IIT and once in Tanjavur, where a physical meeting has happened. It's like 1 day, 1.5 days event has happened. All the cost has been distributed by all the members, and we ensured that all the members have participated. And out of 2 events in Chennai, right, we had online presentation from BioNEST, and for the Tanjavur event, we had Mr. Manish Diwan coming and physically participating in that event. So this is another lesson. And apart from the cluster convergence meetups, we also have cluster connect meetings, means that each incubation center or 1 or 2 incubation center will come together and will say that I'll contribute in this particular area. And they started working. And this is how we have classified. And each incubation center have identified, or the cluster has identified that we are going to work this in this 5 verticals. It's marketing, clinical, industry, skill development, and regulatory. And we have identified one of the incubator center as a lead incubator, the other one as the assist the lead incubator, and we have shared the responsibility. And this 5 areas has been identified based on the brainstorming session that we have happened last year when Dr. Manish was there, and we shared all our problems. We had about 2-3 hours of discussion, and then we have listed out, we have grouped, these are the problems that we are facing, and how can we find an answer, right? So I have to thank Dr. Manish coming there and giving work to us. He came there. We thought that he'll be coming out with some initiatives. He's going to write a check for us for each of the initiatives, because we are hearing more words like BRBC, BRTC, BRCCs. Many BRBCs are there, but we don't have an opportunity to work with that. So we are waiting that we'll get some TRBC something, but TNBC something. We didn't get anything, but good strategy. He listened to us. He jotted down, he classified it, and he told that your team has all the strength and you can find an answer from yourself, and it has started. And that's what Dr. Kalaiselvi also told us today morning, that we have all the resources within us, and that's how we have started. And these are the initiatives that we have done. And a few photographs on this, what we have done at Tanjavur, and this is the event about what we have done at Chennai. So what are the learnings that we had? One is collaborative. We have come together, we have started collaborating each other, and there's a synergy, co-creation. These are the jargons. But really what happened, see, these are the things which I can openly say as a PowerPoint presentation, or I put it in a wordings as a jargon. But really one great lesson is, nobody is superior than us, or nobody is inferior to us as a fellow incubator. Right? We are not carried away with the numbers. If somebody says that 135 incubators we are having, 25 incubators we are having, 30 incubators we are having, we are not carried away with all these numbers. Why? Because if Crescent announces an initiative and it says that, can you nominate your medical related startups for Market Connect? If I don't have a person to nominate, that means that this is my weakness. Right? No need to have any review at all. If Tirupati Incubation Center announces a program and says that nominate your startup, yes, I don't have a startup to nominate, that is my weakness. So there is no need to have any reviews. There is no need to have any reports and things like that. People will announce a program. People will launch a program. As a fellow program organizer, he will write a mail to me. And my colleague says that we don't have a startup in that particular area or in that particular stage, then that is the gap where our team has to work. So it has become like an effort, and it becomes like a evaluating ourselves, where we stand, where the gap is, how this gap has to be addressed. Is there anyone with another 2 months of effort can reach to that particular level? We'll take a stock and we'll say that, okay, in the next program, we'll nominating about 2 or 3 startups in that particular area. So one small suggestion is to the BioRack team, especially Dr. Chaya, if you want to evaluate the Tamil Nadu bio clusters, don't invite us to Delhi. On every month, Thursday, you just log in between 11 to 11:45, right? You know what we are doing it, right? So no need to invite us to Delhi or to see what we are doing it, because we know where we stand and what we are doing and things like that. And we slowly started building specializations, right, on regulatory. Dr. Anand Thirunakar started working on clinical things and on regulatory. Bala has also been supporting it on compliances and things like that. Certain initiatives needs critical mass. And as I told you, 6 incubators are in Chennai, 3 incubators are outside Chennai. So we don't have a critical mass. So unless otherwise we come together, we collectively do something, we can have a specialized programs. And these kind of initiatives, the cluster initiative has helped us to have the critical mass of the startups to do it. Inclusivity, right, and enhanced visibility and access to experts. But every initiative has a challenge, right? We had 2 challenges. One is leading the initiative. I don't think so 9 cluster members will not be against my endorsement. It is the IIT HTIC team which drives that. I have to thank Sumitra, I have to thank her, because she is very prompt. And if the CEO is not coming for the monthly meetings, right, we'll be nominating our colleagues and things like that. If the CEO is not coming for the monthly meetings for consecutively 3rd month or 2nd month or 3rd month, politely she'll call 2 days before and say that, Dr. Suresh Kumar, can you chair this month's meeting? She'll not ask me why you are not coming, right? She'll say that this month you have to chair the meeting and you have to be the, so we have to accept it and things like that. So it is the initial days. Even today, it has been the ownership that has been taken by one incubation center, and we started listening to them. Whether it is Muthu calling or Sumitra calling or anyone calling, we don't worry about who are calling us. That's the word I use, the word inclusivity, right? One thing is, most of the incubation center CEOs, we know the top level, but we don't know who is working in the second line. But if startups want something, unless otherwise the second line gets connected in an incubation center, things will not move. Whether this equipment is functioning, this equipment is charging more, this startup wants this, right? Not always the CEO can talk to the other CEO. But one thing what we have addressed here is, because of this cluster meeting, since we are nominating the second line and third line officers or the technical people in the meeting, right? There is no hierarchy, or it's like a flat organization, the cluster, as far as cluster is concerned, and the second line, third line people are having the freedom to call the CEOs and say that I need this help, and things are moving fast, right? Sustainability, right? Initial sustainability issue was who will drive this. That has been addressed, but today's sustainability is we are expanding, right? More requests are coming from the startups. More programs has to be organized. And if an incubation center itself is discussing about sustainability issues, right? How a group of incubation centers which are facing sustainable issues come together, how the cluster can be sustainable. So that also I leave it to BioRack team to look into it. And if you have any questions, I'll take 1 or 2 questions on the cluster. If not, thank you for the support extended by all the cluster members the last 4 years for having a wonderful experience as a cluster initiative. Thank you.
Thank you, Dr. Suresh. Sir, I would,
Come.
So I request all the representatives from Tamil Nadu BioClusters to please come on the stage for a group photo.
Big brother, big sister, even though not part of the cluster, man, we need your support. from today on. We don't want to miss you.
Good evening, ladies and gentlemen. I am Harshita Bhavsar. So, as we are heading towards the last session of the event, I am honored to welcome you all to the session E-YUVA Incubation Spurring Innovation. E-YUVA encapsulates our commitment to empowering youth for undertaking value-added innovative transformational research. It represents our belief in the transformative power of young minds and their ability to drive meaningful change through innovation. Pre-incubation is where the seed of innovation is planted, where bold ideas are conceived, and where potential breakthroughs are born. It is a crucial phase in the journey of any innovators and project for laying the groundwork for future success. Currently, we have the network of 20 pre-incubation centers across the nation located at the 12 states and UTs. So, without any further delay, I would now like to call on the stage our panel member for this session. So, I would now request Ms. Gitika Dayal, Executive Director, TIE Delhi NCR, and the E-YUVA Committee Chair. Ma'am, please join. So, Ms. Gitika has been leading the TIE Delhi NCR for over 2 decades, renowned for her exceptional contribution to India's entrepreneurial ecosystem. She has received numerous awards, including the Best Executive Director globally from TIE Global. Our next panel member is Dr. Rohit Sharma, Professor and Chief Coordinator of E-YUVA Center, Punjab University, Chandigarh. Dr. Rohit is a distinguished professor at Punjab University, Chandigarh, with over 23 years of experience in microbial biotechnology. As a Chief Coordinator of E-YUVA Center and Project Leader of BioNEST, he is driving force behind innovations and entrepreneurship. Welcome, sir. Our next session member is Dr. S. Meenakshi Sundaram, Professor and Chief Coordinator of E-YUVA Center, Anna University, Chennai. Dr. S. Meenakshi Sundaram is a distinguished professor at Anna University, Chennai. He is a renowned expert with 25 years of experience in bioprocessing optimization and protein expression. As a Chief Coordinator and Chairman of the Entrepreneurship Development, he oversees all the innovations and incubations activity at the university. Welcome, sir. And our next panel member is Dr. Saprishi Chatterjee, Associate Director, Incubation and Chief Coordinator of E-YUVA Center, Admas University, Kolkata. Dr. Saprishi is a accomplished microbiologist with over 10 years of experience in teaching and research, with 20+ research papers and 2 patents, and numerous awards, including recognition from DST and participation in international exchange program. Welcome, sir. Our next panel member is Dr. Preeti Chandurkar, Coordinator, E-YUVA Center, Career College, Bhopal. Dr. Preeti has over 15 years of experience in biotechnology. She has received several recognitions such as Best Senior Teacher Award and has authored numerous research publications. She extends its leadership into various roles, including convener of Nutritional Society India and coordinator for startups and entrepreneurship, demonstrating her commitment to fostering innovations and academic growth. And last but not the least, I would like to call upon the stage the moderator of the session, Ms. Shilpi Kochar, Head Strategic Partnership and Entrepreneurship Development. Ms. Shilpi holds more than 15 years of experience in leading large national level grant programs, implementing policy initiatives focused on promoting startups and building strategic national and international relationships. With this brief, I would now hand over to our session to the moderator to take forward the discussion.
Yes, working. Thank you so much. Thank you so much, Harshita, for the kind introduction, and thank you, Dr. Chaya, for having me moderate this panel. So since morning, we have been discussing about incubation, beyond incubation, scaling incubation. So this is a topic where we discuss about the pre-incubation, how we really create the pipeline for incubation. But we have a tough job here to do because we are starting at a time we were supposed to finish. So now I request the panelists to be brief right in the beginning, but we'll also be meaningful and to the point and add value to the discussions that have happened since morning. And we really need to discuss as to why this panel is very important. But as the job is tough, but there is a silver lining. Because we are discussing a topic which is very, very important. And as you see the word E-YUVA, which brings a lot of energy. So I think this was strategically positioned at the end of the day so that it can bring back the energy which was there in the morning. So the word yuva, back in the office we were discussing why we have this hyphen in between. So Harshita was asking me whether we should retain it, we should remove it actually. And then we were thinking that the full form really doesn't align very well with the kind of acronym we are using. But then we decided that because this hyphen actually puts an emphasis on yuva, let's retain it. So this scheme, which is a very important one, focuses on the youth. In the morning, we heard UGC chairman. He spoke about the power of youth, the number of young students that we have in the universities, and how BioNEST is trying to fit in the adapter between the incubation, the industry connect, the entrepreneurship, and the university culture. So taking the lead from there, and we now build up this panel. But before we start this panel, I'll just try to satisfy the WH family. Why we are doing this, how we are doing this, where we are today. So just a little bit of the WH, why we really need to do this, why we really need to capture the young minds. So as you all know how important the kind of energy that these youth carry, and you'll hear from the panelists and the E-YUVA chair, committee chair, who's a stalwart in the area. So the kind of energy these students bring in makes it very important for us to actually empower our initiatives, increase our initiatives in this particular area. And how we are doing this in this scheme, which is in pre-incubation, we house within the university setup, we have an area of somewhere around 3,000 square feet, where the students, the UG students, this is the only BioNEST scheme where we have UG students, where they have an area to work, they can work full-time, they can work part-time, and the only scheme which bets on the UG students who are pursuing their studies. And we have students coming from different disciplines coming together for one particular project. And then where we stand today, we started from the University Innovation Cluster back in 2014, where we had 5 such clusters, 5 such university clusters, and today we are at a count of 20. And we have recently added 10 new, and these 10 were in the morning, we were embracing the growth, and we have added all new footprints across the country. So with this, our family has expanded from 5 to 20, and we have a very diverse panel sitting here today. We have 2 of our representatives who were earlier UICs and now E-YUVA centers. We have 2 new E-YUVA centers, and they're also diverse with regard to their geographical representation. We have representation from north, from east, from center, from south. So a very well thought of panel that we have put together, topped up by the presence of E-YUVA committee chair. Thank you, Geetika, for being here. So with this, I'll open up to the panel. I'll request each of the panelists to give a 60-second insight into the scheme. I'll request Dr. Rohit to start with.
At the outset, I would like to thank Team BioNEST for inviting us to share our thoughts of the last 10 years, almost a decade, as Dr. Shilpi has said. it gives me a real heartening time that when I see this map of India, I remember this map of India in 2014 as our journey dates back. When we applied in 2013 for this UIC, as Dr. Shilpi mentioned, and were sanctioned, I remember Dr. Meenakshi Sundaram and me, we were here at India Habitat Center at that time when the first award was given, announced. And at that time, we were, as Dr. Shilpi said, it's a geographical division amongst the panelists also. And up north beyond IIT Delhi, that was the only dot that we had. Today we have 75 red dots and 20 blue dots. Congratulations to BioNEST. And I've seen this journey right through. That was a time when UICs came into existence and there was hardly any documentation. I've seen that through. Dr. Meenakshi would vet it. That even the KPIs, the performer for intaking innovation fellows, performer for guiding the centers, it was a very autonomous setup that was brought into place where inputs were taken from us and we used to have meetings of the centers for finalizing them. And look, that has grown from 5 to 20 today. We have completed a decade for us and the other 4 centers at the national level. Keeping this journey in mind, we've been discussing since morning, we've been listening to everyone talking about that pipeline of incubatees, as Dr. Shilpi said. I would say this is a technical pipeline of incubatees where those people are already trained for something called innovation. If I look at that ecosystem up north, Dr. Jitendra would vet it, we hardly had anything at that time when we were doing our PhDs. And that was when we started it off there. The students used to come to us, sir, isme PhD degree milegi? They were not knowing that. They were so naive about things up north, I would not beyond IIT Delhi. And it was real task for all of us to convince people, to talk to those people, to talk to those young minds who were looking at those PhD degrees, knowing very well that in this grant of 18 months plus 2, 6 months, that was initially it was 2 years, that they would not get any degree called PhD, still do that work. And they were very happy. I still remember students were happy getting that 30,000 rupees as a pocket money per month. I'm telling you the journey that happened. And today we are talking of that ecosystem which is very vibrant. We are talking of that ecosystem where a bachelor student has also been brought into this ecosystem through that E-YUVA fellows. That's all congratulations to Team BioNEST for thinking that way. And I would add, if I go beyond the boundaries, it would be very, very vibrating if we go back to even the schools and pick up those innovators from that stage so that they are, we can say, grassroots level innovations, whichever are coming from those schools to make this system more vibrant. I'll come back after.
Yes, thank you so much, Dr. Rohit. So I'll alternate between the mature ones and the young ones. So next I'll request Dr. Preeti to tell us about how their experience has been with the E-YUVA Center. With Career College, it was our first footprint in MP actually. So we seeded the first pre-incubation center in MP with the Career College coming up.
Absolutely right, ma'am. Thank you very much, BioNEST, for inviting me in this wonderful discussion panel to talk about, see, we belongs to MP and we are from a small city called Bhopal, where you cannot find a culture of innovation and entrepreneurship. The students were just doing the basic research and still they wanted to do the research. They, as sir said, they said that, madam, is this work can be converted into like our PhD or our PhD work can be counted here? So we said, no, this is completely about innovation and innovative products. So you have to have some innovation or some innovative product in your mind and then only you can apply for this particular scheme. So this E-YUVA scheme is extremely fascinating and especially it provides a unique opportunity to the students for, engaging them in unique research projects right from their early years of undergraduations. So we see that even the first year students, the second year students of undergraduation can apply for the scheme. And these young students have so much in their mind and they they come up with so innovative ideas, not even the MSc pass out and the PhD pass out can even think of, I think. So I think this project and the scheme is very good. And in central India, say in MP, when the culture we have started it, and now the people know that this scheme is here and they are now motivated to think like that and they are motivated to apply for this scheme. Thank you, ma'am.
Thank you, Dr. Preeti. I now request Professor Meenakshi Sundaram for his thoughts.
Good evening. I first thank Bharat for giving this opportunity to express our views on this. As Rohit said, 10 years back when we started this as a thing, only innovation fellows were there. At that time only the big grants also started, and it was easy for the people to go for big grants than to come for innovation fellows. And mainly initial stages we had some tough time where people take this as a stopgap things. PhD people join, they gone for PDFs, postgraduates join, they say we are going for in between. So initial phases, though we had some issues and things, later we proved that if you come as innovation fellows, you have very good opportunity of getting further funding and things like big grants and also the other startup grants and things. The program started picking up, and now we had latest call and all, more than 1,000 people applied for these grants, which itself shows the success of these things. So I think we will talk about that.
So last but not the least, as the center representative, I request Dr. Saptarshi for his insights.
We always speak about that the students never knew what to do and how to create a startup. But let me start with my journey, what BIRAC has impacted. 5 years before, one of our advisors called me in my university and said, can you take care of the incubator? And I said, we already have 2 lab technicians, why do you require a faculty to take care of an incubator? Because it was just an instrument for me. And from there, I am sitting in a panel with the distinguished people in this journey. So that has been the impact of working on the only BIRAC footprint in West Bengal, the E-YUVA Center at Adams University. So if we say that BIRAC is a book and each of the beautiful chapters are the BioNEST, we are the alphabets who try our best to change the mindset. And from a place where probably the person who is leading the incubator was not aware of what incubation and what process would be, today I am proud to say that we have got the highest number of E-YUVA applicants in India. So I think that has been a phenomenal journey in motivating in motivating and transforming the mindset of the students, because we have got people who have cleared UGC NET exam, has not joined or taken that fellowship and has availed innovation fellow. We have got faculty members in institute who have left the job to become innovation fellow. I think that's the impact BIRAC has created, and I am thankful to BIRAC for giving us this wonderful opportunity to serve the nation.
Thank you, Dr. Saptarshi. Having heard the insights from the center representatives, Geetika, you have a tougher question because you're committee chair. So you're not just going to give us the insight. Just compare it with your experience, because you have a very varied experience in various sectors and not just biotech. So with respect to the biotech innovation ecosystem and with the E-YUVA scheme, the kind of impact that it has had and the potential it has. So compare it with other sectors also, your experience, and then give us your insights on being a committee chair for this program.
No, thanks very much. Thanks. And I think it's a privilege to be a chair for this. And as you can see, they've chosen a very young person to be a chair for, the the E-YUVA scheme.
Because it is E-YUVA, no?
Yeah, thank you very much. So, but just on a serious note, I think this is the only scheme
that really addresses the undergraduate level and has brought together universities and the E-YUVA centers, etc. So that itself, I think, shows where the intent lies. There is immense talent, immense potential in the youth, and we all recognize that. But most of the time, they don't have an opportunity to enable them. And even when they do try and say or do something, they probably come across experiences where they are not taken seriously. But here is a scheme that not only encourages them to come forward with their ideas, but at the same time, it is nurturing them, providing them as much support as possible. So I think that itself is great because these are porous minds. It's not meant to be just a scheme with the intent of disbursement of funds. This is going to create a mindset shift, which we have been seeing as you talk about, how the students perceived it to the changes that are happening. So it's going to actually be a mass movement that is designed for scale. We have already seen how the numbers have doubled. And the success that it is creating, it's bringing about collaboration, awareness, and all of that. But at the same time, I think I have to say, from the other side, when we compare it to other sectors, as you mentioned, there is a significant difference. For example, the sectors early on, as the startup ecosystem was evolving, sectors like education or health, hospitals, etc. There was a very different mindset when it came compared to the tech sector, because there is a desire to do good. You're doing something which is a service. You're doing something which is not for profit. So the ability to put the hat and say, how can I actually commercialize it as a for-profit venture? How can I get it funded? How can I commercialize it? How can I take it to market? Who are my customers? The language that is used in other sectors was not typically used in health or education or biotech. But that has been a change that has happened over the years. And in this case, in particular, what is most commendable is that BioNEST itself initiated that change. It was not random, founders here and there who were trying to struggle and find the opportunity. Right from the beginning, this was, conceived as a mission that would make a change in the country. So that has happened, but as a chair who has seen right from the beginning, I have to say from the first meeting when we saw the presentations from every E-YUVA center and the universities, etc., there has been a sea change in how they are performing now, how they come up with their numbers, their reports, their expectations. And with that, very honestly, our expectations are increasing. If a center is doing well, for us, that's great, but we want them to do more. We want them to do better. So we will keep, pushing you more and more to perform. We will not sit back on our laurels and say we've done a great job. Anyone who needs help will be provided that help, but you have to come back and, give us more of what we all want to achieve out of it.
Absolutely, Geetika. There is a lot more that we really need to do. And just connecting with what you just said, this sector doesn't have that kind of a mindset of the finances. And this particular program very early on gives the students and the entrepreneurs, innovators, who typically belong to the scientific mindset. And this was very rightly being pointed in the previous panel also by Dr. Diwan when he mentioned that putting the numbers together, the profit and losses, and saying this is EBITDA. So that's not EBITDA actually. So if this finance, if the students who belong to particularly science, the other sectors typically have these kind of subjects or maybe knowledge or some kind of discussions happening. But particularly biotech, life sciences, these students and the faculty, the researchers, entrepreneurs need that kind of mindset change where they have to think about the commercials also right from very beginning. And that's where the entrepreneurship mindset comes into. So thank you very much for your thoughts. And then now, I had made a long list of questions, but we have to limit it to 15 to 20 minutes. I think Chaya would not allow us more than that. So then she's smiling. Okay. So that means we have kind of 15 minutes left. So this question would be particularly for the E-YUVA fellows. As this scheme has two components, the E-YUVA and the Innovation One. So this particular question, I'll request you to limit your responses on the E-YUVA fellows per se, which is a multidisciplinary group of 3 to 5 students coming together to take up the project. So I request Dr. Rohit to point out 1 or 2 challenges that you have faced, or these students have faced and have reported to you, and you would like that should be overcome.
Couple of things which have come up in the last couple of years is one, the advertisement is given for the final year students. This I pointed out at the time of review also and at the time of the presentation for extension also, that the students in the final year of their graduation, most of the times approval takes some time and the students come back to us because the ones who are there from engineering colleges get placed, and the ones who are there in graduation, some get admission in master's courses and some move on for other jobs outside the city. So they come up with those requests that kindly substitute our team member sometimes, and that's from the students' end. And sometimes there are very unique problems. Most of the mentors are very professional, but in some cases students even have that problem that they lose on the mentor who goes missing sometimes, that I am not ready to mentor this any further, or I am not. The moment it comes to transfer of that grant to the mentor maybe looks at it as a sort of a liability that the UCSC has to be given by the mentor, because those mentors are their teachers, but they have not taken up the job of being their mentor for their projects. So that's a sort of you can say a gap which we need to fill in. And if we pick up students from first year or second year, that will be very good. And if it is to be done for the third year, then we can have it along with the academic year starting, have a selection done at the year closure of the second year, and the onset happening at the beginning of the third year of the student, so that they get complete 1 year and there is no gap in the project. And straight away we can look at those evaluations after 6 months and then finally close it down after 1 year, and they become eligible for BIG grant also. Once they get a graduation degree, that's a very effective pipeline for BIG also and for incubation. So that's my thought about it.
Absolutely. So that's one of the operational challenges that Dr. Rohit has pointed out. So Professor Meenakshi, would you like to add to some of the challenges that your students or your fellows would have faced?
Yeah, there's some other thing. When we start middle of the year, there are some college principals also were afraid that the student will close in between this project, how we can sign the agreement and things, who will take care of the students after the things, because most of the students are in hostel. So what Rohit said, they should start in the beginning of the academic year, when the academic year is closing the things. And also there are certain other issues that when they, mainly in the case of a government institutions, they, even though the fund is transferred directly and say that you have to give a private auditor statement, they say that fund has come to our account, so we are supposed to meet the audit and things. So they follow their procedures, all procedures and things. So that sometimes the students were saying that it is taking long time for us to get the things done and things. Though we give them financial freedom, it has not happened in government institutions.
All right, maybe these are some certain things we really need to look into while we discuss our guidelines and improvisation. So let's now maybe stop the complaints a little bit, and now I come to Dr. Preeti, and I request you to speak about how further empowerment of these students can actually take place, the E-YUVA and innovation both. What additional steps can be taken, or what other additional initiatives from the institute side that you are taking up and you would suggest others also, and BIRAC maybe, to empower these students further?
Yes. So apart from providing them mentorships and hand-holding from industry partners, collaborators like BioNEST partners, and from research institutions, what we can do extra, or what we can do is like we should provide them an IP support. We should give them that knowledge that IP creation is very, very important, and that actually we are doing. Secondly, I think industry immersion program is very, very important, because by giving them this industry immersion program, they will be getting direct opportunity to work with the established startups and industries. So they will directly get the hands-on practice on this. So I think they will learn by this thing more.
So you mean to say that the E-YUVA fellow with a 1 year period should have an immersion period as well?
I
Maybe
think
after they
that,
finish
yes,
this
once
1 year?
they finalize that this particular product now, this is all done, and then we have to move for commercialization and all. So then they have to be they have to choose the specific industry, and then I think this industry immersion program can be conducted.
Okay, so in your experience of last 2 years, have certain teams reached to that particular stage where they are ready for that kind of an immersion, and they have certain prototype or certain, as in some success story that you can probably share?
Yes, ma'am. Actually, in the UG program, I think the mandate was not there that a product should be developed. But in all our projects, the students have a ready-on product which can be commercialized. So we finished this currently only in Feb 2024. The project was completed. So now we are in tie-ups with our BioNEST partners also, and we are looking some industries. So we are providing this hand-holding and mentorship to the students for taking the next step.
All right, thank you. So Dr. Saptarshi, if you can build on this alumni engagement program further, as in how we can these students who pass out, they complete their 1 year, what your suggestions are on building or the engagement further with them?
Yeah, for the E-YUVA fellows, we normally prefer an interdisciplinary team and of various different years, so that in case of a final year student being exiting out of the team doesn't have a problem. Because that is the same scenario a student, when he goes to an industry, they have to work with different specialization and different age group of people as well. So that is one sort of training we provide. For E-YUVA, there is another thing which causes a hindrance is, suppose a 5-member team holding an IP, and after some time they decide to create a startup without all the 5 members being involved. So that's an issue we faced. But fortunately, all the 5, we have got a few startups. We have got a good number of IPs being generated from the undergraduate E-YUVA teams.
That's very actually promising and surprising fact that the UG team as in came together and filed IP, and all 5 of them were contributors to it.
Yes, and we have got IPs, and interestingly, 2 of the teams have decided to create a startup. They have completed their tenure, but now they are in the process of incorporating their startup. And one of the team is proceeding towards clinical trials. So they have already been contacted with the MedTech Mitra of ICMR, and they are proceeding towards clinical trials. They have been backed by 2 hospitals, and we could connect AIMS with them. So they are also going for clinical trials.
That's pretty encouraging and one of the success stories of E-YUVA probably.
But again, we want that in our part of the country where most of the students would not stop after undergraduation, they would either prefer for going for a post-graduation, or according to the NEP, they might go for a PhD. So if these projects are carried forwarded in an industrial mode with a collaboration with industry for a further research and other field, I think that would be helpful for those teams as well.
For the innovation fellows, yeah.
No, even for the E-YUVA teams.
All right. Thank you so much for that insight, Dr. Saptarshi. So now maybe we go back to Dr. Rohit once, and then if as a BioNEST also and as a E-YUVA center also, and within the E-YUVA scheme we have a provision of BioNEST mentoring the E-YUVA center as a knowledge partner. So how your experience has been with that connect, and what you think about it?
Yeah, that's a very good and important question. And it's been a very great help for our E-YUVA fellows and innovation fellows, both, because they get multiple benefits. One, they are able to come up and use the infrastructure that has been created under the BioNEST program. Second, they get a chance to interact with all mentors who are there for the BioNEST. They get at that stage itself, they get a direct connect with all types of investors or people who deal with financial systems. They also get access to all types of IP systems, because most of them are very naive to protecting their IPs. They get a chance to meet people who mentor them for commercialization of their product also. So it's an excellent bridge that the innovators who are housed at PU E-YUVA Center, that they get access to all these facilities. Apart from that, when we talk of empowerment with regard to the scientific values, they get access to all the systems within the campus because we have a state-of-the-art CIL SAF facility which takes care of more than, I would say, a massive number of samples for analysis coming from the north of India because it has all types of instrumentation, high-end instrumentation, which is accessible to the BioNEST incubatees. And we have extended that support to the E-YUVA fellows also. And they get mentorship for their analysis, means if they have to detect a product and we are looking for some authentication of a product, they get that too. So that's how I can say that when you're having a combo of E-YUVA and BioNEST, that's how the grooming of those fellows can happen.
Absolutely. So I go back to Geetika now as I have to cut short the discussion. I'm getting from the team. So what, in your opinion, would be an appropriate success metric for the scheme as to how we measure that the scheme is doing well or not doing well, and what in your perception, should we be measuring in under E-YUVA?
So typically the bottom line of any project, any scheme ends up being, the ROI. And ROI can be measured in different ways, It depends on the kind of value or the kind of impact that is being created for the cost that is being incurred for that particular scheme. So when we look at that, I think, that is one of the things that has been very, very, big area of focus for us as we run these programs, is that there is a very robust system of actually ensuring what is the scope of the entire scheme, what are the specifications, is there proper adherence to that, what are the various reviews that are constantly taking place, and on the basis of that, feedback is incorporated, and at the same time, the intent to scale it up, to do better has been implemented. What we have been seeing is that there is a requirement that has come in to say we need to interact and get more feedback from the beneficiaries, from the fellows directly, because they are the ones who are the eventual beneficiaries. We have also felt that there is a need to have more of, more collaboration. So while there is healthy competition among the E-YUVA centers, but at the same time, there is a great spirit of collaboration as well. And we have to encourage more of that cross-pollination, because every success story that emerges will be a success metric that we will be able to track. The more noise we can create around that celebration, the better it is collectively for the entire center. And BioNEST has enabled a lot of these opportunities for all of us to meet together. So I think all of you, all the E-YUVA centers know who's the other one, what are they doing, what kind of work is happening, who's being, incubated there. So if we can do more of that, I think that really is going to be something that will lend itself more to how this can continue to grow and how the number of E-YUVA centers can keep increasing. But we have to be very, very conscious of the fact that all the effort, and it's not just the money that's being put in, it is being put in, of course, but at the same time, the effort that everybody is putting in, the time that all of you all are putting in, first of all, it's extremely commendable. So I do want to take a moment to actually applaud all those who have been running these E-YUVA centers, and putting in regular time and effort into it. But at the same time, the more of it that we can do and celebrate our successes, I think that is something sometimes we ourselves get so used to just, putting the effort and working behind it, we forget to celebrate our successes. We must make more noise around that. And people will sit up and take notice. We will not be ignored. We will not be ignored anymore.
Absolutely. I think let's have a great round of applause for all the E-YUVA centers with this. A big round of applause to all. Kudos. Before we conclude, just one last comment starting from this side. Dr. Preeti, one of your just quick 10 seconds remark.
Thanks so much, ma'am. So this scheme is, as I said that this is very fascinating. because this giving opportunity right from the UG level, and they have so much in their mind, they are coming with innovative ideas. So as we have the only center in Central India, and we want to continue with this.
I think we have added one more today, so now we have two in MP.
Now we have two.
Yeah.
So thank you so much for giving this opportunity. Thank you, BioRack.
Dr. Saptarshi?
I would just like to highlight a small success story which I would like to share. This time we got an application from a very rural college, and all the 5 applicants were students of history who have applied under the mentorship of a zoology professor. So when it was inquired that what made you apply to the E-YUVA scheme, they said we found that during our skill development program that this is something unique and we can make it a startup. So I think in line with the NEP, if we can increase the horizon of E-YUVA beyond the boundary of bioscience, I think that would be good for all. Thank you.
Thank you.
I would say that now today IITs and all universities, leading universities, everybody is being graded how much is the placement and how much is their average salary. Maybe in course of next 10 years, we should say that how many startups have come, how many investments. That should be a benchmark for the institutions.
Right. Wonderful.
I hope that.
Absolutely.
I'll just take a leaf out of the morning session where our great honorable chairman of UGC spoke. I would request BioRack, if you could initiate what sir said, that we could have somebody talking to them with a proposal for the universities so that they can set up some system in place and come up with a vibrant system and have multiple. When we talk of scaling up EUVAs, he is the best man who can come in and pitch in and support the system for bringing in the vibrance which is actually required. So, and he has very positively spoken about it, and he, I think, culminated his talk by saying that if anybody has a proposal, we can talk and discuss. So, Dr. Jitendra, if it can be done at the BioRack's level, any one of us, whosoever is there, whom you deem fit, can also pull in. Please take up that from this is my suggestion.
Sure. Thank you. Geetika, one last from your side as well.
A big congratulations to everyone, and Shilpi, we've all taken our moment to highlight our thoughts, but thank you for moderating this so well. And Chaya, Harshita, all of you, Dr. Diwan, Dr. Jiten, thank you once again. And to all of you who have traveled from all corners of the country to join here, this is what we have been all working towards. So very grateful for being able to do this together.
Thank you so much, Geetika. Let me just conclude it on behalf of all the panelists of what we heard so far, that the E-YUVA scheme has already begun to show the kind of results, the kind of encouraging results we have seen. We have success stories, and there are thoughts for improvisations on the operational front, but we are beginning to see the results, and there is a long way to go. So with this, let us put our hands together for the panelists. Thank you so much for being a wonderful panel. Thank you so much, everyone. So back to you, Harshita.
Thank you, ma'am. And thank you, panelists. It was a wonderful session filled with the insightful discussion. And the strategies and best practices that we have just discussed here, so we'll take it forward and improve our scheme so that it will benefit the young minds and entrepreneurs. So with this, I would now like to request Dr. Manish Diwan, Head Biofoundry NCR Biotech Cluster, to join us on the stage to present mementos to our panel members. So please. And to Dr. Rohit Sharma,
to Dr. Meenakshi Sundaram.
We've been there for a very long time.
To Dr. Chatterjee. To Dr. Preeti. And to Ms. Shilpi Kochar. Now I request Ms. Shilpi Kochar for the concluding remarks and vote of thanks.
So as we conclude today's discussions and deliberations, it is my pleasant duty and privilege to present a vote of thanks on behalf of BIRAC and DBT. The insights that we have gathered today point towards an exciting and exponential growth trajectory of biotech innovation ecosystem. First and foremost, I would like to express heartfelt appreciation for all our esteemed speakers, panelists, moderators, for sharing their invaluable insights, expertise, and experiences. So all of the contributions made by these speakers and panelists have enriched our discussions and inspired us all. A sincere thanks to our BioNEST and E-YUVA community for their support and dedication in making this event possible. Your commitment to fostering biotech innovation ecosystem is truly commendable. We are deeply grateful to all the participants, attendees, delegates for their active participation, engagement, and enthusiasm throughout the conclave. Your presence has made this event a vibrant and enriching experience. With deep sense of gratitude, I thank Dr. Rajesh S. Gokhale, Secretary DBT and Chairperson BIRAC, for his vision and leadership to steer the outcomes. We are immensely grateful to our Managing Director, Dr. Jitendra Kumar, for his continuous support and guidance throughout the entire planning and execution of the event. Thank you so much, sir. I would like to extend sincere thanks to the entire BIRAC team for the hard work and dedication in planning and executing this event flawlessly. The BioNEST and the E-YUVA team, led by Dr. Chaya as in charge incubation, who has worked extremely hard with the support of the team, including Harshita, Rashmika, Apurva, and Dr. Nidhi, need a special mention here. A big round of applause for the team. As we formally conclude this conclave, let us carry forward the spirit of collaboration, innovation, and entrepreneurship nurtured here today. Together, let's continue to drive the positive change and make a lasting impact in the biotech and life sciences innovation ecosystem. Thank you all once again, and we look forward to future collaborations and continued success. Thank you, everyone, very much. So with this, we come to the end of the conclave. I just thank you all once again for being here.
The tea and snacks has been served outside. Please join us for the same.